Okay, well, welcome everyone to day 2 of the 2021 Action Forum to End Social Isolation and Loneliness, hosted by the Foundation for Social Connection, with support from our sister organization, the Coalition to End Social Isolation and Loneliness. I'd like to begin by extending a sincere thank you to our world-renowned speakers and inspirational leaders who joined us yesterday. We heard compelling perspectives from federal and global partners on steps policymakers are taking to catalyze communities and sectors to take action where they are. We also heard from leading researchers who introduced the need for a systemic framework to guide comprehensive cross-sector approaches at all levels of possible impact, as well as articulating the business case for healthcare and other sectors. Finally, we heard from leaders across the country on how each of us can get involved through national awareness movements and federal advocacy. Before we get started today with day 2, a little housekeeping and some acknowledgements. I would first like to acknowledge the staff of the Foundation and the Coalition for their tremendous work and countless hours they put into bringing this 2-day event together. Meg Wallace, Connor Beauregard, Rachel Jordan, Matthew Itzkowitz, thank you for your dedication and leadership to this cause. A major thank you also goes out to our Coalition members and production partners, Meals on Wheels America and Humana, for supporting the program from start to finish. And finally, to all of you, the speakers, the thought leaders, the change agents, the advocates who have brought your full minds and hearts to these 2 days and in your daily work. A sincere thank you to all of you. If you were not able to attend yesterday's session, please know that we will have segment recordings and transcripts, associated slide presentations, and the resources provided within the chat box throughout the day available on our website at www.social-connection.org, and we'll be providing that to all of you. If you have any questions about anything you heard yesterday or today, please reach out to the Action Forum 2021 event staff at af2021@social-connection.org. And please note that for those interested in live transcription throughout our program today, there's 3 easy steps that you can take. If you look at the bottom of your screen on your computer in the Zoom menu or toolbar, you'll see live transcript option. If you click the live transcript option, you'll have 2 options there, one to show subtitles or one to show full transcript on the right side of your screen. If you need any additional assistance on this or anything else throughout the day, please reach out to the Action Forum team member in the chat. So for today, we'd like to take a shift in our perspective from that bigger picture strategic thinking to a more tactical one. The very crux of the Action Forum is to catalyze commitments to action by all stakeholders. Throughout today, you will hear updates from organizations who made commitments to action in 2021, and we will conclude today's program with an exciting review of organizations who have made commitments for 2022. Along the way today, we will also discuss actions underway to engage state and local leaders, discuss ways in which community-based organizations and individuals have and could engage in this fight, engage in a thoughtful dialogue on the role of technology in this space, and share ideas that can be taken by or in partnership with funding and philanthropic organizations. As for me, I'll be taking a back seat today to make room for our new Deputy Executive Director of the Foundation for Social Connection and the Coalition to End Social Isolation and Loneliness, Ms. Jillian Rakusin. Jillian has been instrumental in the development of the 2021 Action Forum and will be leading us through today's program. Jillian, thanks for everything that you've done, for your leadership, and thanks for taking it away today.
Wow, thank you so much, Eddie. I am thrilled to be here and to join in this incredible movement. Our first segment today focuses on community activation. I am delighted to welcome Kelly Cronin, Deputy Administrator and Director of the Center of Innovation and Partnership at Health and Human Services Administration for Community Living, Lisa Marsh Ryerson, President of the AARP Foundation, and Emily Allen, Senior Vice President of the AARP Foundation, who will be discussing the Commit to Connect program, including the Social Isolation and Loneliness Intervention Clearinghouse. Emily, I'm so excited to turn it over to you.
Thank you so much, Jillian, for that great introduction. We are so excited to be part of this second annual or Action Forum, really in focusing in on a new initiative that AARP Foundation is so excited to be part of, the Commit to Connect initiative that we have been working so closely with our great colleagues at the Administration for Community Living and so many different organizations across the country. And so we want to just dig in a little bit. As Jillian indicated, I'm Emily Allen, and I'm the Senior Vice President for Programs for AARP Foundation. And I've had the good fortune over the past year plus, I guess at this point, to be the lead for the Coordinating Center. AARP Foundation is serving as the Coordinating Center for the Commit to Connect initiative. And it's just been, I've learned so much. I always feel like, it's such a good use of time when I learn, as well as try to, share my learnings with so many others that have been part of this great initiative. So, this is I think indicated it was a panel, but I really just want to have a discussion with two people that I think are just such great leaders in this space. Kelly Cronin with the Administration for Community Living, and of course, my leader, my great leader, Lisa Marsh-Ryerson, President of AARP Foundation. So welcome, Lisa and Kelly. It's so great to have you here today. And so let's dig in a little bit. We know titles and things like that, but Kelly, I would just love to learn a little bit more and have you share with the audience a little bit about your role at ACIL.
Sure, yeah, and thank you for having us be part of this panel. It's great to share more about our work and make sure everyone knows about what we're doing so we can get more people involved. But my role at ACIL is leading a Center for Innovation and Partnership. So we have a lot of various programs that reach both older adults and people with disabilities, everything from trying to help them with their access to their Medicare benefits or navigating their Medicare benefits, low income benefits, also trying to connect them to long-term services and supports through the No Wrong Door system or Aging and Disability Resource Centers. We do a lot of work trying to partner between the community-based organizations that focus on aging and disability, the populations we serve, but also integrate with healthcare, because we know it's really important to support people at times of transition from the hospital or from the nursing home. But also, as we see such a focus on social determinants of health, it's so important that we partner across the social services and community providers with healthcare. And so that's increasingly happening, but we're doing a lot to try to better align those efforts so we can really build on the community assets that do exist and have been funded for a long time by federal, state government and philanthropy. And so we also fund assistive technology programs across all states, and do a lot to try to coordinate across federal government, because ACIL, of course, within HHS has a big HHS family to work with, including Medicare and Medicaid and CDC and HRSA. But importantly, HUD and USDA and these large departments that fund nutrition programs and housing that are so essential to populations we serve, those federal programs are really critical to sort of bring into sort of the overall coordinated effort to try to serve people. So, so we do a lot of that sort of partnering across government and with state government to try to facilitate access to services that people need, and better meet them with sort of a holistic package of programs and services. So that's a little bit about what I do and that's the center's focus. Of course, I would say during COVID, we've had so many important things that we've been trying to address real time. One of the most pressing certainly has been social isolation. I mean, as we know, it's been a long-standing public health crisis. That's right. But during COVID, it's just been on steroids and so front and center. And I know US Aging and other organizations through surveys have found it is the #1 pressing issue in older adults. It is. So we've been so fortunate to be able to work with AARP Foundation and the many partners we've brought together to really try to address this incredibly important issue.
Yeah, well,
I'm jumping in, Emily, because you said in your intro, well, first of all, how great to be with the two of you. The three of us have been working on these issues for many, many years, but really focused over the past year, as you were saying, Kelly and Emily, on coming together to encourage others across sectors to come together and address the rise of social isolation and loneliness among people of all ages, but in particular, as you were noting, Kelly, among older adults and persons with disabilities. I so appreciate that we're speaking together at the Action Forum, because Association for Community Living and AARP Foundation have always been about action. And I think it's so fitting that we've come together around action for this issue to truly address this key social determinant of health. And, you know, Emily and Kelly, no better timing.
Right.
We have the opportunity, as Kelly was noting, and Emily, I know you found in leading our many programs, social isolation and the vulnerability that people of all ages have been experiencing over the course of the past 18 months draws attention to this growing and important problem, I think, in a way that allows us to build our network of champions.
Absolutely.
And to build an interest in cross-sector partners and entrepreneurs to be focused on building evidence-based solutions that we're able to scale, and additionally scale those great solutions that we know are already being deployed in CBOs across this nation.
Right.
So,
absolutely. Yeah, no, thank you, Lisa. I think picking up on a couple of things certainly that you both said, it really is, and I think that's one of the reasons why AARP Foundation wanted to get involved with this, is the cross-sector nature of this, obviously. And then the B part, really, Kelly, and you know, I have to credit Lisa with really thinking about how do we bring a variety of organizations together to solve, you know, a really growing problem. And no one organization can do it alone. And so you're absolutely right, Kelly. One thing that we were particularly excited about is kind of building on the National Academy study that AARP Foundation sponsored. It really was about strengthening the ties between community-based organizations and health systems that really need to come together to address social isolation, particularly among older adults. And so, you know, I think that's just such a key theme. The other theme is really that, and you mentioned it, Kelly, it was really around, you know, we know that, you know, 1 in 4 older adults were already experiencing chronic social isolation prior to the pandemic. So it was a problem even with the pandemic. And then what was really revealed as a result of the pandemic was the fact that it wasn't just about an individual problem or an issue that people were having. The fact of the matter is that, and this is what leads to connection to social determinants, you know, individuals who are isolated as services were shutting down were going hungry.
Yeah,
you know,
right.
They were not able to connect to the resources in their community that had been available to them. And so many, many more people, quite frankly, across the age spectrum, began to experience challenges with getting their basic needs. And that's certainly, Lisa, you know, something that AARP Foundation has been focused on.
That's right.
Right from the start.
Yes.
They're thinking about how we bring those solutions to bear.
Well, and we know, as the three of us are speaking, we know that in order to help older adults and persons with disabilities to move, not just to survive, but to thrive and to tap into their own agency and resiliency, we have to address increased social connection, both to that reliable social network, as well as to the network of community supports and resources, Emily, that you're speaking about. And the pandemic laid that bare, as it did many other important, really deeply entrenched social issues.
Absolutely, absolutely. So I'm assuming that there's going to be people in the audience and the viewers of this that are aware of Commit to Connect and how we've come together, but there's likely others that aren't. So Kelly, can you kind of give us a little bit of a background on the Commit to Connect initiative, how it kind of got started, and what ACIL's involvement is in it?
Sure, yeah, I think it really started as a nascent activity in the spring of 2020 when we were first all trying to, you know, together get through that early stage of the pandemic. And because it was so apparent, even in those early months, that social isolation was going to be one of the big issues to tackle. We just started reaching out to other organizations we knew were mission oriented, who were already committed to addressing. Of course, you having it like an existing 8-year portfolio in this space, we're a natural partner to go to. But NCOA and US Aging and some of our partners in the assistive technology community across states who had a lot of technology savvy around this, Leading Age. There were so many natural partners that were already doing important work. And we knew if we partnered together, we'd be more effective if we organized our work together. And so that, I think, we just had a lot of iteration over a number of months to try to conceive, what do we do? What is our public-private partnership? How do we bring it together? What do we call it? And that's how Commit to Connect sort of came to be, over this sort of coming together of the coalition of the willing, who were mission oriented. We could all together get around this aim of trying to reach millions of individuals who are socially isolated. And at the same time, ACIL was launching a challenge competition to try to address what we were hearing from a lot of experts and stakeholders around the need to just try to better connect people to the resources that already exist, right? To what your communities already have available, or to what technologies exist that older adults don't know about, or people with disabilities, or other folks who may not be, technology savvy or know about what's available to them. So we wanted to sort of make it easier to connect people to what's out there, and what could bring meaning to their life in a way that would be impactful to them and be connected. So that challenge competition yielded a clearinghouse that we've now been sort of working together on. How do we build out and scale and make part of a broader campaign? But in parallel, not just to have, ability to have like an online platform to connect people, but we knew it was really important to leverage champions across all communities, people who are already doing this work, who are really in the trenches within the aging network, across the AARP resources, across all state chapters, many, many different players across sectors. Health plans are doing a lot in this space, as we know.
Absolutely.
There's a lot of important partners, but we wanted to be able to connect them in a meaningful way and be able to facilitate the growth of their work, or the replication of some of the most promising efforts, especially those that are evidence-informed or evidence-based, and creating a nationwide network and a collaboration platform for them, we thought would be really impactful. So that's sort of how we all together evolved this notion of the nationwide network of champions. If we connect all those local champions, help them learn what they're doing, and those that want to replicate the really successful models, have a community and a platform for them to be able to do that in a way that can be done with fidelity, or in a way that adapts for that other local community that works for them. But the ability to learn and share best practices across these sectors, across communities of interest, we thought was going to be potentially really impactful way to grow the initiative.
And as we're getting together, Emily and Kelly, let's celebrate that we have over 100 champions in the network.
Yay.
So that,
just through a soft launch.
Just through a soft launch. just through a soft launch, which really, Kelly, as you were speaking, underscores the point that the three of us and our organizations had a lot of evidence about great work in this space that was occurring across multiple sectors and in communities around the nation. And our core commitment to say that, we are leaders, ACL and AARP Foundation, and helping drive collective impact. I think that is some of the best of our work, is that we came together and we're able to set up a framework. And Kelly, you and your team have been real experts and leaders in working with Emily, Emily, you need to speak soon about just the day-to-day leadership of this, but we set those bold goals out there, as you said, Kelly. Let's get to literally millions. Can we get to 10 million and then onward, individuals who are older adults, persons with disabilities, and connect them to the right resources? I very much appreciate that we broke it down into meaningful chunks of work, that we would have a clearinghouse so that ultimately we could, as you were sharing, Kelly, shine light on those solutions that could be effective tools for individuals or organizations, that we could underscore the need for evaluation and building bodies of evidence, that we would develop the scientific advisory group, which is helping us think through what that evidence is, and also how do we continue a culture of evaluation so that we understand which solutions really do help a person understand where they are on their own continuum around social connection and how they can increase that connection. And then the weaving of the network of champions. What I've appreciated already is we have individuals across spaces, whether they are working in adaptive technologies or working with the intersection of identities of older adults and persons with disabilities, to be sure that we are on a daily basis responsible to meet people where they are at and across their identities, to be sure they have the tools and resources to maintain their social connection, their social emotional health, to be sure that they thrive. I keep going back to that. For us, as you know, Kelly, and you know, Emily, my force around this is that you cannot solve for senior poverty. You cannot help older adults secure the essentials and thrive without fundamentally and first recognizing their need for connection. So I, as you were talking, Kelly, and you, as you were speaking, Emily, am so excited about our ability to say, it's new work, but it's really just lifting up good, essential work and entrepreneurship and digitalpreneurship, which is happening across our nation. It was happening pre-pandemic, but needed to be maybe turbocharged by Commit to Connect. And that is what ACIL has done. Commit to Connect provides that, the turbo supercharge energy that we need to go forward in this space and to make it sustainable.
Absolutely. No, I think you're so right. And we've learned so much. And I think you'll hear a theme of soft launch and things like that, because, you know, and again, I think you're absolutely right, Lisa. You know, this is an action forum, and AARP Foundation certainly has a bias to action, as I know.
We do.
Does. You know, it's like we can think about and we can plan all we want to, but until we actually put something into play, that's when you really learn. And I think we've learned that from, you know, the committoconnect.org website, where we want to have people come and learn a bit more, obviously, about the issue, because we're still in a space in this nation. I mean, if there is a silver lining at all of this pandemic that we've all had this shared experience through, is that people are far more aware of how isolation may be affecting them or affecting someone that they care about. So that's the good news. The more challenging news is that we've got to bring individuals together to learn more about the impact of social isolation and the need for increased social connection, and then provide information to both of your points about what are the solutions that are working. Because, and Lisa, you certainly brought this to AARP Foundation. It's there's a lot of solutions being built, but are they really addressing the problem?
That's right.
People tend to get, you know, a little bit excited about a new solution or a new program or a new piece of technology, but are we really starting with the problem it's trying to solve? And so that's what I'm excited about with Commit to Connect and the work that we're doing collaboratively, and particularly with the nationwide network, is we can really dig into and understand what may be working. Maybe it's working for a small number of people. How do we replicate that then? How do we convene dialogue and facilitate the technical assistance that may be needed so that each organization doesn't have to reinvent the wheel? It's really building that community of practice. And so I think we're really excited about where this might take us. And you're absolutely right. I mean, you know, it's one of those things, it's like you launch something and cross your fingers that people will want to be involved. And it was really overwhelming, even though we really just kind of talked about it through our networks, over 100 organizations really representing good geographic dispersion, a wide variety of populations that they're serving. And so we're really excited about creating this bi-directional communication, which was really at the heart of Commit to Connect initiative, is how do we create that bi-directional where we provide information as an initiative, but then we learn from what's happening out there and facilitate those dialogue and that convening. Lisa, jump in.
Well, I think it's also, and I want to turn back to Kelly, I think what worked is that Kelly, with your leadership and your team at ACIL, and Emily, your leadership and our team at AARP Foundation, and then that first network, the organizations who came together to think about the charter and our commitments. But Kelly, you and the team were constantly focused on driving toward outcomes. And so I wouldn't want us to end our session without really underscoring our commitment to evidence, to driving outcomes, to this bold goal of millions, has driven us to use the disciplined frameworks and logic models that ACIL and AARP Foundation always use in a space where I'm thrilled with growing interest, but we want to be sure that those who are developing solutions or sharing solutions start with who are we serving, the to what end questions, and how will we know if our solution has actually increased social connection in a meaningful way for the individuals we're serving, so that they do have access to community supports and resources that help them maintain their health and well-being, and that our solutions are distributed equitably across communities and populations. So Kelly, I nod to you because it was that always going back to when will we know if we are successful? And you were appropriately dogged in reminding us of that every step of the way.
I think we all shared that vision together. And I think we're also pragmatic in knowing that we're not there yet with the evidence base. So we had to be deliberate about the logic model, about the evaluation strategy, and it's still a work in progress. You know, how are we going to fund all this? How are we going to do the PSA cycle evaluation as we go, so we can replicate and learn more as we have more community experience, or as technologies are part of a broader community program. So it's one facet of an intervention, perhaps. So I think there is still a lot of learning we're doing, but we do have the deliberate intention to build the evidence base. And then we also just need to know, how do we meet people where they are in their community, because not everyone has the bandwidth. We're still in emergency response road, right? Like, we know our resource centers, our area agencies on aging, other CBOs, they are still flat out trying to get vaccines out, trying to help with testing, try to, you know, especially now it's getting to long-term care, various long-term care settings with boosters. And so there's a lot of responses still happening that are sucking up a lot of energy and time, and people have been fatigued too. I think we're aware of the challenges community by community, and we want to be, you know, meeting people where they are, but make it easier for them to do work in their communities to still make that impact. And if we can offer that support through the network, the nationwide network, to make it easier and partner them up with people who've done the work successfully, that will help spread. And I know as we get past the Delta variant and hopefully through this whole pandemic, that we will still have a lasting effort, and this will be ongoing for quite some time. And so as we learn more and grow more and have more and more champions and the ability to learn together, I think we'll see more and more success.
Yeah, you know, Emily and Kelly, I'm sorry, Emily, I get so excited about this topic, which you lead, but as you reminded us in the beginning in your opening, Emily, and then Kelly underscored it. Social isolation was a public health crisis pre-pandemic. As you were just speaking, Kelly, it's ongoing. You know, here we are 18 plus months in, and with the variant and ongoing need, it's growing. So those numbers are growing, and our work was fueled by the pandemic, but must continue post-pandemic, because all of the sudden, the millions of older adults and people with disabilities will not be connected. They will not all have, you know, robust social connection when whatever the next stage is. So we are committed to this issue for the long run as a group of colleagues, and for an ongoing building of solutions that help us reach the millions of people who need us. But Emily, I keep thinking about, I mean, you need to jump in, because you are leading not only this effort in the coordinating center, but also led our work for the National Academy's study and our direct service work, where we see the problem of social isolation among low-income older adults each and every day.
Absolutely. No, and a perfect segue. I was going to talk, and you know, Kelly, you brought up, and one thing that we were really excited is I felt like right from the beginning, right from the very first conversation we had with ACIL, we knew there was a lot to learn about launching something like this. You know, normally I think when a clearinghouse gets built, it's kind of like there's a lot of great solutions out there that, because somebody says, oh, let's put it all in one place. Wouldn't it be great? But that's really what we had to do, and we're really building those blocks. And I felt like we were speaking the same language, and things like, you know, let's do some sprints. You know, let's build this via a sprint process where we really put a minimum, literally a minimum viable product in place so that we can build on that, taking all of the great feedback from all the great organizations that were part of the Startup Steering Committee, as well as the nationwide network groups that are now part of it. And that's really, I mean, we were really of like minds that, you know, we weren't going to, you know, launch this huge thing. We were going to do it in incremental points. And that's really has been our philosophy for many years at this point, really led by you, Lisa, as we do our innovation work. It's about, let's test something small. Let's build something. Let's see if there's, you know, if it's solving the problem that's really out there. Is there demand for this? You know, we really had to think about that too. And I think early evidence, particularly as we think about the nationwide network, is there is a demand for bringing cross-sector groups together. And so again, it was great because we were so like-minded of how we build this. And your other part, Kelly, which I thought was so important, is organizations out there are stretched to the max, you know, and so we really wanted to, and this is where I have to give, you know, a shout out to Eddie Garcia and the Scientific Advisory Group, who have really been lockstep with us to think about, okay, if in fact there isn't, you know, dozens and dozens of evidence-based solutions, how do we build and inform individuals that if in fact you're going to begin to think about investing in a program, here's the things you need to be thinking about, you know, and without being prescriptive necessarily of exactly what the program might be, building on what we know from existing programs that seem to be working, what can we learn and what can we pass on to others? So we were just really of like minds as we thought about kind of this sprint process and this minimum viable product process that we've been going through. So I just appreciate, you know, that kind of like-mindedness that we had as two organizations coming together. So anyway, let's turn to the future. So we talked a little bit about, you know, kind of where we've been, how we've been on this journey together. Kelly, I would love, you know, for you to just say, you know, where would you like this to head, and how can organizations get involved?
Great question. And I think we are figuring this out together, right? And following the lead of people that are really engaged and doing a lot of important work with impact. But ultimately, if, you know, things play out on a similar trajectory, I think we want to have a lot of champions actively participating as a part of this network. So they're learning from each other. We're able to form sort of learning pods or learning communities that take, you know, the most successful community-based programs, you know, with or without technology, and bring them to other communities and bring the right partners together. So it could be sustainable over time. And that may be a health system or a health plan or community health center. You know, there could be many different partners that will be really the committed people to keep this going over time. And I think also we know that there is some funding still out there at a state and community level that HHS has administered or the federal government has administered as a part of, you know, the COVID response, that we hope will continue to allow for some flexibility to spend at a local level, but make the most of that in bringing in, you know, these other NGOs, other community-based organizations. And it may not always be the CBOs that we fund. It could be Catholic Charities or Lutheran Services or somebody from an AARP chapter that steps up, you know, to be that local organizer, but to have the other partners that have the reach to the people that we want to serve. I think we need to formalize or help build those partnerships that can be lasting at a local level. Give them the tools through the Nationwide Network platform to be able to easily implement and replicate things that will work within their community that are a good fit for them. For their populations, and be able to reach the, you know, in a culturally competent way who they're trying to reach. I think a lot of building of that nationwide network that will happen. I think we also need to iterate a lot on that clearinghouse to make sure we have a complete set of technology solutions that can be matched appropriately and then used, in a way that works for that user. They know how to do voice activation if they don't have fine motor skills, or they know how to, adapt and make it a part of their lives to be able to connect to people that they want to be connected with, or to their interests, their passions, things that brings meaning and joy to their life. So I think as we continue to iterate on the clearinghouse, we'll build more meaningful solutions, both community-based and technology-based, that we'll be able to, in addition to community-led efforts, be able to allow direct access to.
Sure. Well, we have just a couple minutes. Amazingly enough, I could go on all day, quite frankly. This is just a conversation. Kelly, you and I meet on a regular basis, and I've just really appreciated our great collaboration with Lori and Alec from the team as well. But kind of the same question, Lisa, as we wrap up. I remember a little over a year ago, I started talking to you about, hey, we've been having these conversations with ACL. Where would you like to see us take this, as we think about addressing the needs of low-income older adults in our nation in particular?
Yeah, thank you. And when you had those conversations, as Kelly knows, I said, let's have more. And I was so pleased. I want to go back to the real collective impact framework that ACL and AARP Foundation have built, based on the understanding that our network and our clearinghouse, our council, our scientific advisory group are all committed to the same outcome, the same goal. But then we approach it through the lens of our own organization. And we know that, for me, the future is that Commit to Connect is an ongoing effort, and it will become more robust over time. That we are a learning community where you share the knowledge and expertise you have as an organization or individual across a variety of sectors, and where you gain information, where you have gaps in your knowledge as you're working to serve individuals in communities or to build solutions for individuals. So it is, as you said, Emily, that mutuality. But I want us to be the beacon for recognizing, as we do at Commit to Connect, that social isolation should not be addressed as an afterthought. Right. That it is much more important to address robust social health and well-being upfront for individuals and for communities, because it is less expensive for the individual in terms of personal expense, what happens in their lives, and the harm if we are not connected. And it is literally less expensive for us in communities as a nation to address social isolation upfront as well. So that is my hope, that we understand the importance of the issue and the importance of Commit to Connect, and that not just now, but in the future, any person in an organization or as an individual or CEOs of companies know that they head to Commit to Connect, where they will find reliable resources and a community of learners and leaders who are going to solve for social isolation in the long run.
Great. Well, I can't think of a better way to wrap it up. So thank you, Kelly, for this and for your great partnership over the last many months as we address this issue. And of course, Lisa, thank you for your leadership on this issue for a number of years now. This is so exciting. And so thank you to the audience for being part of the dialogue. Go to committoconnect.org to learn a bit more. So thank you.
Thank you, Emily, for being the leader at the heart of bringing all of this to life.
Absolutely.
Thank you both.
Wow, thank you so much for that fantastic discussion. Thank you again to Emily, Lisa, and Kelly for their time and for sharing their perspective today. I know that there's been some links dropped in the chat to join the nationwide network of champions and to learn more about the Commit to Connect program. I'd also like to add a small plug for our next Commit to Connect event, Connect Plus Healthcare, which will take place on October 13th, just next week at 12 p.m. Eastern. This interactive conversation will feature Carla Perissinotto, who we got to hear a little bit from yesterday, professor of medicine at UCSF. It will also include Lisbeth Briones-Roberts, who is the Chief Togetherness Officer at SCAN Health Plan, as well as Sarah DeSilvi, who is the Director of Clinical Informatics at the Gravity Project, which is a nationwide initiative to implement social prescribing in healthcare settings. My colleague is going to drop the link to that registration link in the chat, and we hope to see you there. I will now be turning it back over to Eddie Garcia, Executive Director of the Foundation for Social Connection, to speak to us about this past year's commitments to action. Over to you, Eddie.
As many of you know, the Action Forum is centered around catalyzing multi-sectoral, multi-stakeholder commitments to action to drive greater social connection across the globe. At our inaugural event last year, we secured 10 organizational commitments to action, and we are delighted to provide you all with an update on those commitments today. I will kick us off for the commitment made by the Coalition to End Social Isolation and Loneliness and the Foundation for Social Connection. Last year, we committed to convene a scientific advisory council, a national standing body dedicated to increasing the translation of social isolation and loneliness research into real-world application. Chaired by Dr. Julianne Holt-Lunstead, we feel honored to have brought together 9 leading researchers and academics focused on this issue. The SAC has met monthly since last fall and is working on numerous translation projects, such as the Gravity Project, a program dedicated to developing new ICD-10, SNOMED, and CPT codes related to social disconnection. The Commit to Connect Clearinghouse, which is an online platform with information on social isolation and loneliness, evaluated interventions, and the Innovation Accelerator, which is guiding innovators to develop evidence-based solutions. Last November, we officially formed the Foundation for Social Connection to house our programmatic and research-driven work. The coalition also grew through that body of work and others with added perspectives from the Never Tech Late, IN2L, Nextdoor, Make Room at the Table, Pix Health, and Act Now for Mental Health. We've had tremendous progress over the last year in growing our research body of work and in gathering new participation in the coalition. We're thrilled of our progress and look forward to the year ahead.
Hello, I'm Risa Wilkerson, Executive Director of Healthy Places by Design. Social cohesion is a vital part of our vision for healthy, equitable communities where everyone can reach their full potential. During the Action Forum last year, I announced that Healthy Places by Design would co-create actionable recommendations for advancing the field by addressing social isolation through a community-level lens. With support from the Robert Wood Johnson Foundation's Global Ideas for U.S. Solutions team, a group of practitioners and researchers informed this work. The report, Socially Connected Communities, Solutions to Social Isolation, was released in March, along with 2 action guides, one for local government and community leaders, and the other for philanthropic leaders. This report contains 5 recommendations centered on asset-based, equity-focused, and inclusive approaches. Since March, we've been sharing these recommendations with local, state, and national leaders through webinars, podcasts, conference presentations, and blogs. In addition, Healthy Places by Design has launched a Learning and Action Network for community-level policymakers and advocates to discuss and expand upon these recommendations. To learn more or to join our Learning Network, please email us. Finally, we're pleased to announce our partnership with the Coalition to End Social Isolation and the Foundation for Social Connections to support a broader social connection learning and action network. Together, we are aligning and integrating our efforts to promote policy, innovation, research, and sustainable strategies in order to address this issue from local to global levels. It is an honor to share this update with all of you, this growing family of colleagues who are dedicated to creating a sense of social cohesion and true belonging for all. We hope to connect with each and every one of you very soon.
It's wonderful to hear the first updates on the commitments to action made at the 2020 Action Forum. Look out for more of these updates throughout today's programs, as well as new commitments made at the end of today. Our next segment features a panel discussion on state public health perspectives as part of the National Association on Chronic Disease Directors Building Resilient Inclusive Communities Initiative, otherwise known as BRIC. I would like to introduce the moderators of today's session. Vish Basani, Associate Director for the Center for Community and Environmental Health at NACDD, and Mara Galick, Technical Assistance Manager at the Building Resilient Inclusive Communities, NACDD. Joining Mara and Vish are our esteemed panelists. We have Tiffany Branstetter from the Pennsylvania Department of Health, Jana Simon from Illinois Public Health Institute, and Christopher C.J. Johnson from the Hawaii State Department of Health. There will be a few minutes of Q&A at the end of this segment, so we welcome you to please submit any questions for the panel in the chat. Mara and Vish, I will turn it over to you.
Great, thanks, Jillian. So happy to be here and welcome everybody to our session on social connectedness, a public health perspective. So as with many other issues, the need to advance social connection as a public health priority has really been amplified as a result of the COVID-19 pandemic. So our session is going to focus on a public health initiative here in the US called Building Resilient Inclusive Communities. That will highlight public health as an ally in the social connectedness space. If we can go to the next slide, thank you. The BRIC Initiative is led by the National Association of Chronic Disease Directors in collaboration with the Centers for Disease Control and Prevention's Division of Nutrition, Physical Activity and Obesity, and the Division of Population Health. And so before we get to our panel and hear from them, just wanted to warm us up a little bit with a couple of poll questions. If we could run the first two questions. So the first one is, we'll just take a few seconds, is to what extent do you engage with public health in your social connectedness efforts? And then for those that who responded like here or there or not at all, we would love to know how interested you are in engaging public health. We'll give that a few seconds. Okay, so it looks like the majority, 46% of you are engaged with public health in your social connectedness efforts, and really great to see that 69% of you are really interested in engaging public health. And we really hope that through today's session that we spark an idea or connection that you may not have thought of. Thank you, so we'll close that. If we could go to the next slide. So the BRIC program addresses three strategies: improved nutrition security, safe physical activity access, and of course, greater social connectedness, reducing social isolation and loneliness, what we're here to talk about today. Health equity and social justice principles are integrated throughout the implementation of these three strategy areas with the goal of creating resilient, inclusive communities. And the overall strategies that are implemented are policy, systems, and environmental change, which in hearing all the sessions yesterday, the systems approach is really aligned with the work that we are doing. So next slide. So the BRIC, we have 20 states that are implementing the BRIC program, as you can see on the screen, and they collectively are working with 63 communities across the country addressing nutrition security, physical activity access, and social connectedness. The majority of those 20 states are through state health departments and a public health organization in that state. Next slide. And so here in our panel today, we have three of our states, Illinois, Pennsylvania, and Hawaii, very early for Hawaii, here with us today in the panel to talk about their work on social connectedness. And I think it's really important to say that although social connectedness has not explicitly been a part of our traditional public health approach and efforts, it's our hope that through the BRIC program, we are able to meaningfully and strategically really build partnerships and bridges with other partners, some of you on this call, in working in this space, and really inform future public health practice. So we hope that through today's panel, we inspire some greater connection. So in the next part, we're going to actually now engage our panel. and we have some questions. The first one is, and if we can go to the next slide, is really for all our three panelists, Jana, CJ, and Tiffany, to tell us about your social connectedness effort in your state and what's happening. Jana, we'll kick it off with you.
Great, thank you, Mara. Hi, everyone. I'm Jana Simon. I'm the director of our Center for Policy and Partnership Initiatives at the Illinois Public Health Institute. And through BRIC, we've really been working with two regions of Illinois. One is our Southern 7 region, and one is St. Clair County, which is sort of East St. Louis area. And I want to really touch on some of the partnerships being built in St. Louis. The Egyptian Area Agency on Aging is working really closely. Sorry, this is Southern Illinois. The Area Agency on Aging is working a lot with one of their local health centers, Shawnee Health Alliance, and they are really thinking through how to create some partnerships and referrals into the telephone reassurance programs that the Area Agency on Aging has been hosting, especially during COVID, as well as connecting to a new sort of IT and training program. So there's been a big push, as you know, to increase access to technology and broadband and such to help older adults especially connect during the pandemic. And so they're trying to create some partnerships to develop referral systems from people who are identified as in need of those services and into the program. So there's this nice health partnership going on with the aging system to really increase that work. And similarly in St. Clair County, there's a faith-based community coalition, MTC, working with their Area Agency on Aging to address and adopt and build some systems around an art therapy program that is out of UCLA. So the addressing loneliness through movement and art. They are really trying to create, again, some referral systems to identify older adults and youth who are interested in the program, connect them into the program, and create some more partnerships between these sort of community-based coalition groups and some of the services being offered. So partnerships is a huge part of what we're doing. And I will say some of the other events around nutrition security and physical activity are also promoting social connectedness. The photo here on the bottom left is a group who recently did a community walk audit in Cairo, Illinois, and they came together in teams, and it was really a nice community event to come together around volunteering together. And on the bottom right, there's some community gardening work connecting to food pantries in the region. And again, bringing community together to help cultivate the garden and get the food into the food pantry. So partnerships is really helping us build the systems, and the social connectedness is a result of a lot of the work we're doing. So I'll turn it back to you, Mara.
Thanks, Jana. And I like how you integrated some of your social connectedness and physical activity work. Really great. Next slide. Tiffany, I wonder if you could share with us some of your work in Pennsylvania. Not sure if Tiffany is available. Maybe we'll go to next slide. CJ, do you want to?
Sure, you bet. Yeah, so my name is CJ. CJ Johnson. I'm with the Hawaii State Department of Health. Prior to the pandemic, my main role was physical activity coordinator with the Chronic Disease Prevention Health Promotion Division. And that means generally focusing on systems, policy, and environmental change that improve equitable access to active living and active transportation. For the past year, like a lot of folks probably on this call, I've actually had a second hat, right, a pandemic hat, and working as our community partnerships lead for the department's COVID outreach and public health education initiative. And so obviously, just like everywhere else, we have suffered from disparities in COVID disease activity, vaccination rate that have closely resembled a lot of our persistent chronic disease disparities that my group tracks. And in Hawaii, that demographic composition of the disparities is distinct from what you see in a lot of the US. Our populations of concern are Native Hawaiian, Pacific Islander, Filipino. Pacific Islander, just as a quick side note, is a very broad generalization that encompasses a number of distinct subpopulations, including Samoans, Tongans, Marshallese, and Micronesian populations. And even within Micronesians, there's a number of cultures and languages. During the pandemic, we worked really hard to identify organizations and leaders that have been working with these communities that, even if they weren't public health partners initially, right, they were delivering food or hosting in-language rent assistance webinars or promoting food drives or translating guidance, or we're trying to support them with resources, capacity, public health guidance, and coordination so that together we can provide COVID outreach and education that's timely, accurate, and informed by community needs and experiences. There's obviously a really strong, I'm really excited to be here, there's a really strong natural connection connection between active living, disease outreach and education, and social connection, especially in the era of COVID, right, which has proved to be a common challenge for all of those things. And I think nowhere is that overlap more present and more persistent and more challenging than with older adults. Older adults have been disproportionately impacted by COVID. They are disproportionately vulnerable to social isolation, alienation, and many of the supportive programs and environments for both social engagement and physical activity have been paused or defunded because of the pandemic. So we've got a couple of programs that we're really proud of. The first one is our partnership with a Trust for Public Land, the Hawaii chapter of Trust for Public Land, that is to support a community-driven participatory design process that's intended to reactivate Aala Park, AALA Park, which is an underutilized city-owned park in the heart of Kalihi, which is a dense urban underserved community in Honolulu. The park activation has been including installation of kind of using community experience, interviews with longtime residents, seniors, to capture the history of the park as we work to make it over. The goal here is twofold, right? We want to make sure that Aala Park revitalization will be a supportive environment for social engagement and physical activity, but also that the process itself will help engage folks and help create an environment that's reflective of the experience and values of long-term residents, many of whom have been, again, stuck inside for the last however long couple of years due to some of the cancellation of programming and restrictions on gathering. The other, and we hope this is a pilot, right, in terms of the role that it can have on systems and environmental change. We really hope that we can scale this, and the partnerships that we've built with community partners and park systems will scale into new policies and system stuff. The other one is a partnership with an organization called Pear Suite, which has been working with a network that we've helped put together of agencies, community-based organizations, community health workers, and volunteers to provide us telephonic and web-based support platform for outreach. And that's allowing us to essentially do more. The Pear was created as a platform for well screenings for older adults, and we've actually adapted the platform to connect community health workers and volunteers who have language and cultural knowledge and access to our priority population through technology, through this telephone technology, and through a kind of a CRM platform, right, to connect and help people answer questions about COVID, follow up with their appointments, make sure they make it to their second appointment, see how they're doing. And the goal really of this is to create these connections with the community health workers, most of whom are also community members in the communities that we're serving. And then also, as we transition from COVID all the time response to returning to our chronic disease and physical activity and built environment promotion, that we have this database, right? We have these partners, we know how to reach out to them, and we have Pear in place as a really key partner for getting more out of our community health worker partnerships and continuing to track and log our relationships with our populations that we're serving. So I hope that was not too long, but that's kind of where we're at. Thank you.
That's super, CJ, and I really like that you lifted up the intergenerational connections and the role of community health workers. I think essential in our work. I wonder if we could go back a slide to allow Tiffany to talk about her work in Pennsylvania. Tiffany, take it away.
Yeah, thanks so much, Mara. Sorry for that technical difficulty. Hi, everyone. I'm Tiffany Branstetter. I serve as the Obesity Prevention and Wellness Section Chief at the Pennsylvania Department of Health, and I'm pleased to be joining you today to talk a little bit about our social connectedness strategies under the BRIC grant. So Pennsylvania certainly isn't immune to the soaring rates of social isolation, and certainly we recognize that social isolation is experienced deeply by people who are marginalized because of their race or income, sexual orientation, gender identity, and location. And we also know that certainly the COVID-19 pandemic has further exacerbated these health disparities in Pennsylvania and shuttered many of their gathering places for older adults that had previously served as some antidotes to isolation. But the good news is that these issues have been recognized by our Department of Aging, and some great social connectedness objectives are included in our 2020-2024 State Plan on Aging, which served as a great foundation for our BRIC work. So through our BRIC work, the Department of Health is focused on really enhancing our partnership with the Pennsylvania Department of Aging, specifically to explore opportunities to embed social connectedness objectives in our state health improvement plan, including education about the impact of social isolation and benefits of social connectedness, not only amongst our stakeholders and public health professionals, but also in our communities. In partnership with the Department of Aging, we are also exploring opportunities to increase the capacity of systems who support older adults in Pennsylvania, to increase engagement of marginalized populations in evidence-based health promotion and improvement programs. And this support system network includes 52 area agencies on aging and over 500 senior centers in Pennsylvania. And at the local level in Philadelphia, we are working to enhance efforts to support healthy living, active engagement, and a sense of community for all older Philadelphians. We are achieving this by engaging community members, including older adults, in community-led and informed community investments, creating more inclusive and intergenerational connection spaces. This included outreach sessions to local senior groups and centers to engage older adults to inform environmental changes in parks and community garden projects, as well as traffic safety improvements. And on the slide, you'll see a picture of Philadelphians participating in the We Walk Philadelphia program, where in some areas that we had made improvements in Philadelphia. In Philadelphia, we're also enhancing a partnership with the AARP Philadelphia and the Philadelphia Livable Community Network, looking to identify opportunities for cross-supportive social connectedness strategies in the Philadelphia area, and also building social connectedness opportunities and programs into some existing community clinical linkage and referral systems throughout the city.
Thank you so much for sharing, Tiffany. If we could stop sharing the slides, thank you. Tiffany, I wonder if I can keep you here. I wanted to ask you, you talked about a number of different partners that you've engaged in your efforts around addressing social connectedness in your communities. I'm wondering if you could share a little bit more about how you built that bridge between public health and those partners, and how you really worked to establish that mutually beneficial partnership.
Yeah, so I'm happy to talk a little bit more about that. So I would say BRIC provided a really good opportunity to further engage our colleagues at the Department of Aging. So the State Plan on Aging that I referenced provided a strong foundation to kind of start these conversations, and then the resources that the BRIC grant provided allowed us to really approach the Department of Aging from a perspective of offering support to help advance our common goals. So we are now convening monthly with the Department of Aging and our colleagues there to discuss collaborative opportunities to advance the social connectedness objectives in the state plan, as well as how we can support some of their equity objectives. We also have engaged their executive staff in our Pennsylvania State Health Improvement Planning Task Force to help. So we recently had them present. So we presented on BRIC and we presented on the State Plan on Aging, and they have now engaged as members of that task force to help support integration of social connectedness objectives in the State Health Improvement Plan. And I will say that, you know, upon reviewing their state plan, I did, as a public health professional, and often we serve as conveners of these various partners, I did immediately recognize an opportunity to make connections even beyond the State Health Improvement Plan and the State Plan on Aging. There's certainly opportunities to loop in our Department of Conservation and Natural Resources and their State Outdoor Recreation Plan. So really starting to build those partners in to increase connectivity around how we can advance social connectedness objectives as a whole in Pennsylvania has been really beneficial in advancing that partnership. We also have been, you know, through this partnership and building that trust with the Department of Aging, now have this opportunity to help build up those system supports at more of the local level with the AAAs and the senior centers. So we're excited and looking forward to that in year 2 of BRIC. And then certainly at the local level, BRIC has provided an opportunity to enhance our partnerships with the Philadelphia Department of Public Health and their capacity to work more closely with AARP Philadelphia and the Philadelphia Livable Community Network to spend some more time to intently focus on how they can better connect programs that are already happening in Philadelphia, but how do we make a more conscientious and intentional effort to increase social connectedness across the board. So
Yeah, and you said something in the very beginning, which is great, just identifying ways to connect around shared goals. And that seems so simple, but is so critical. Thank you for sharing. Jana, I'm wondering if you have anything to add regarding the diverse partners you engaged and how you built that bridge, if there were any specific strategies you used that you'd like to add on to what Tiffany said.
Yeah, thanks, Fish. So our southern Illinois partners, it's a pretty rural area, and so they're pretty close knit already. Most of the folks know who each other is, but they didn't necessarily work together before. And the BRIC funding itself, I think, was a strategy to say, you know, we want to do something jointly on this issue, and we convened partners to create some planning discussions around the use of this fund. So the shared planning helped bring folks together, especially in Southern Illinois. They knew of each other, but to say we're going to do this together and create these systems was really helpful for the plan sharing. And in St. Clair County, the community-based coalition, they've been creating a broader countywide sort of chronic disease coalition. And all of these members, including the AAA and this faith-based group and others, have been part of this sort of new nonprofit that they're creating together. But again, they hadn't worked together. And so bringing the funding in and having a convening and a shared planning session helped the faith-based organization say, hey, we've been thinking about this. This is a huge issue in our community and we want to do something. And they said, we want to start some intergenerational programming. And the AAA said, hey, we've got evidence-based intergenerational program. Let's not start something new. Let's use what's evidence-based. Let's start something and build what we can do to get the community most in need hooked up with what is evidence-based and something we can offer. So they were able to marry those two needs together, or the resource with the need, because of purposeful planning. So the planning and the funding together help bring people together around that.
That's great. Thank you for sharing. In the interest of time, I'll just move to our last question. And CJ, I would love to start with you. If you could share a little bit more about, in your experience and in your opinion as well, what value does public health, whether it's state or local, bring to the conversation about addressing social connectedness with other sectors?
Yeah, and certainly in my perspective and from our, from where I come from in terms of built environment, right? So I'm a physical activity coordinator, and I think people always think that means that I'm like the guy that teaches you to do jumping jacks or whatever. But the reality of it is, what we do know about physical activity and promoting physical activity as a means to reduce chronic disease is that, of course, the built environment, right? The policies in the built environment that either support or create barriers to that are so important. And many of the policies and environmental elements that we're really interested in have to do with creating public space, right? Shared space where people can interact, where people can walk, use transit, bike, use park spaces, places where people convene, places where people use modes other than cars to get around. There's a huge overlap, right, between that and between physical activity, convening for physical activity, whether that's through programming, whether that's in public park spaces, whether that's just hanging out at a public area. I know I didn't hear the entire conference, but it sounds like maybe that's been one of the themes of the conference, right? Is the importance that connection is really important. So it's been really valuable to us. It was a really intuitive. It's something that we've been really interested in for quite some time. And this opportunity, I think, that COVID and the new partnerships that have come from COVID have really just given us a new set of partners to engage with, and to try to say that, to try to make the case that this stuff supports their goals as well, and say we understand, try to understand better what they need, what the community's concerns are, and how important that environmental support and policy support for active living, right? And I think active living encompasses social connectedness from my perspective.
Absolutely. Thank you so much, CJ. We did get one question submitted to us for Tiffany. If you could share with us any objectives that stood out to you as promising or successful.
Vish, can you repeat the last part of that?
Yeah, it just said, are any objectives standing out as promising or successful?
Yeah, so we're in the very early stages of engaging so we're specifically working with the Obesity, Physical and Activity and Nutrition Task Force of our State Health Improvement Plan, but they have started, we have 3 different work groups that fall under that group, and they've started some early brainstorming in terms of how we can cross-support some of the state social connectedness objectives, and also how we can build them into some of our existing objectives. But it's pretty early on in that process, so nothing concrete yet. But I will say Certainly a core value of the BRIC work is equity and advancing equity. So I think something that's we're very excited about and that I think will be very promising is the opportunity to connect and build capacity in the local AAAs and senior centers to help them reach their targeted populations, because they do such a great job of serving folks who are coming through the door, but often struggle with really reaching the populations that may need them the most. So we're excited about how we can partner and work together to increase that capacity. So very much looking forward to that work.
Thank you so much. In the interest of time, I'll go ahead and round this out. I want to say thank you to all of our states for sharing their insight and their experience. A sincere thank you to the Foundation for Social Connection for inviting us to this forum to share the public health perspective and how, you know, the value public health is bringing to this space as far as being a convener, as far as thinking big picture at a systems level, and really continuing to build evidence and inform evidence in this space. I invite all of you to check out our website, which is on the screen right here, to learn more about the Building Resilient Inclusive Communities, or BRIC program, and also reach out to myself or Mara if you have any questions, if you want to connect with any of our BRIC states. We'd love to make partnerships happen. I see a lot of partnerships already happening in the chat, and so invite you all to think about ways in which you can connect with our BRIC states as well. But other than that, thank you all and have a wonderful afternoon.
Thank you so much, Mara, Vish, and the wonderful panelists for such a great discussion. Extra thanks to CJ for joining us so early in the morning from where he is. We next will be hearing a panel discussion featuring emerging state and regional coalition efforts. This panel will be moderated by Dr. Matthew Smith, who is the co-director of the Center for Population Health and Aging and associate professor at Texas A&M University, in addition to being an esteemed member of the Foundation Scientific Advisory Council. Our panelists today include Maureen Feldman, Director of the Social Isolation and Impact Project at the Motion Picture and Television Fund, Sandra Harris, State President of AARP Massachusetts, and founder and co-chair of the Massachusetts Task Force to End Loneliness and Build Community, and Dr. Emily Ann Ball, Executive Director of Resilient Georgia. This session will also have a brief audience Q&A, so please submit any questions for the panelists in the chat. Welcome all, and I will turn it over to you, Matthew.
Fantastic. Thank you so very much for that introduction. And I'm so excited to be able to moderate this amazing session. And thank you already to everybody. I think that we all know, with the added attention that is being given to social isolation and loneliness, there are so many new synergies, so many new coalitions, task forces, action alliances that are springing up in states and regions, but more local as well. So those opportunities to bring together multiple partners, that's what we're going to talk about. And we're going to hear from Maureen and Emily and Sandra. I can't wait to get started. Welcome and thank you. I'd like to go ahead and pose the first question. Could each of you, and I'll start in that order, Maureen, Emily, and Sandra, could each of you please provide the audience with a really brief 2-minute overview of your coalition, what it is, who's in it, and some of your major primary goals and objectives?
Great. Well, good morning. Thank you for having me, and thank you for moderating, Matthew. So the Motion Picture and Television Fund has been committed to, addressing community needs for a long time. People think we're just about the industry, but we actually are a pretty active community partner. We formed the coalition in 2017 after we hosted a summit on social isolation and loneliness. And there was so much interest. People were so, I guess, invigorated by this conversation. We decided to keep it going. And that's pretty much how it started. I thought 4, 5, 6 organizations would show up. 23 organizations showed up to the first meeting that we had. And so we knew we were onto something. We meet quarterly. We have a summit yearly, except for COVID year. And we focus on best practices, sharing new research, up-to-date information, and forming partnerships and collaborations. And that, I think, is one of the keys to our success and for going on for so long. Some of our best successes to date really have been that some of the coalition members, in fact, the majority, are starting to add social isolation and loneliness screeners into their intakes. Even if it's just one question, we're starting to make social isolation and loneliness and social connectivity a priority to find out if that is going on with the clients or the groups, the individuals, whoever patients the coalition members are serving. Some of our goals are really to standardize the measurements on how we find out about social isolation and loneliness. We want to use the same tools so that we can move towards a standardized way of evaluating our impact and our successes as a coalition. So that's kind of it in a nutshell. Some of the organizations are working with local police officers, training them how to identify social isolation and loneliness in some of our homeless population. We're working with legal services who address older adults, teaching the young lawyers how to identify social isolation and loneliness. And I'm most proud of, we're recently including the IDD community, who has pretty much been left out. So we're starting to work with those organizations to provide some programming to keep those individuals engaged, especially during COVID.
Thank you so much, Maureen. Really, could you please tell us a bit about Resilient Georgia?
Absolutely, and thank you for having me. So Resilient Georgia, we're a 2-year-old 501c3. We were born in April of 2019, and our end goal is to create an integrated behavioral health care system, and we intend to do that by making everyone in Georgia both trauma-informed and resilient. So really thinking about how to be proactive rather than reactive, and working to be upstream rather than waiting until, folks are in the ER with severe mental health issues and in need of, high intensity care. We currently have over 700 stakeholders at the table. So that includes private and public partners. And I very much appreciate the previous conversation about physical activity. Our board chair is Dr. Brenda Fitzgerald, and we were both at the Department of Public Health together. She's the former CDC director and former commissioner in Georgia. So we both bring a public health lens to the work as well. So we've been pretty successful in getting a lot of the public folks to the table that may not have been there in the past. And then we also have our 2 founders are from the philanthropic community. So we've been very successful in getting those voices to the table, because we've found, especially with COVID and COVID response, they're just, they definitely need to be there. So like I said, we have over 700 stakeholders at the table, and what we've done in order to engage the whole state and all the diverse areas of our state is to create different regional coalitions. So right now we have 12 regional coalitions. By the end of 2021, we hope to have 16, and they're basically charged with the same mission. So they're asked to invite private public partners from all walks of life to the table, whether that's, students, trusted messengers, legislators, et cetera. And they create an action plan together. So every region's action plans look very different. They all have short and long-term SMART goals. And they're all really working on resiliency, mental health, behavioral health, and trauma-informed care.
Thank you so much for that. Fascinating. Sandra, can you please tell us a bit about the Massachusetts Task Force to End Loneliness and Build Community?
Absolutely, Matthew. It's my honor to be here, and thank you for the invite. We are a coalition of 30 partner organizations and thought leaders who've come together. We've moved out of our silos and are using our collective resources to reimagine how we can provide that collective impact we heard from the previous sessions today. We are cross-sector collaboration, including state and local governments, agencies, nonprofits, councils on aging, senior centers, colleges and universities, community leaders, healthcare providers, media, and working with under the guidance of the ARP Foundation. Our goal is to ensure that all Bay Staters feel connected to the community and enjoy a sense of social well-being. Ours is a grassroots approach that began in September of 2019. In spring and early summer 2020, we held 4 regional conversations to really gain an understanding of how this epidemic was being manifested in our state. What were the challenges? What were the issues that perhaps had policy implications? Were there things that they were doing that were working and making a difference? On Good Neighbors Day in 2020, we held our first statewide summit where we presented our findings and goals for 2021. And based on those findings of our community conversations, we set 3 major goals. One was to raise awareness of the health benefits of connections and the health risk of loneliness and social isolation. Number 2 was to develop strategies to bridge the digital divide. And lastly, to promote the value of including all generations and addressing loneliness and social isolation.
Outstanding. It is so fascinating to learn more about all of your great efforts. And as everyone can hear, these 3 different initiatives are quite different and have all been relatively new in some ways, but have been evolving as the pandemic has occurred and has been kind of evolving. So with that said, when thinking back to the beginning, for all of those who maybe don't have coalitions or thinking about starting coalitions, you all are quite mature, as you can see in terms of your partnerships. How can you tell any of our attendees about how the coalition developed? What was the driving force behind it? And how did you actually get it started? And maybe we can start with Emily on this one.
Sure. So ours is a little bit different. Our story started with our 2 founders. Like I said, they're from the philanthropic community, and their lens, as you can imagine, is different. Like Sandra said, you know, they saw the need for a backbone organization framed in collective impact to come to the table because they were getting a lot of asks that were either duplicative in nature, they weren't aligned with what other folks around the state were doing, or they were siloed in different ways. So they spent thousands of hours interviewing different partners and just getting insight on what their partners and their stakeholders felt that they needed. And so that's kind of where they came up with the idea for Resilient Georgia. I walked into this space, like I said, with thousands of hours of interviews already done. So a lot of our partners were already at the table, rearing to go when we officially became a 501c3. Since then, we have done an incredible amount of outreach to get folks at the local level really engaged in different ways. And so that's been a very exciting journey. We've been working with all of the, like I said, shared messengers in these different areas of the state. Like many of you, our state is very diverse, whereas we have a huge metro epicenter of our state, and then we have very, very rural areas. And so it's really, we've tried to create learning communities in all of our different regions so everyone can really learn from each other, connect, convene, and build and bolster their coalitions that way. And then we kind of serve as the statewide coalition. So all of the different regions are talking kind of like a hub and spoke model to us, and we sit at the center and get all of the information out.
Sandra, would you like to go next? Tell us how the coalition, your task force got started.
Sure, very similar to Emily. We were having people coming in and asking, begging for solutions and help with finding solutions. We found this especially true with our age-friendly, livable communities who had included addressing loneliness and social isolation as part of their action plan. We were quite fortunate to have working relationships with Dr. Caitlin Hoyle, who is a researcher at the UMass Boston Gerontology Institute. Caitlin had already spent a lot of time in the communities working, especially with our age-friendly communities. And not only was she and her team ready, not only did they have understand the issues, they were ready to mobilize. So the first thing that we did was to call all of the partners that we knew who were already working in this space. We called them around the table and said, Houston, there's a problem, and how do we come together to address it? So from a small group, I guess the initial founders, I call them, of about 9 or 10 organizations, we've now grown to 30.
Outstanding. Thank you for that. And Maureen. Please talk.
Yeah, mine is a little bit different with our organization. I personally was very interested in this. I had been researching and writing papers. I teach older adults how to use technology and specifically on how to stay connected because I saw many of them being left behind basically and not being able to socialize the way they usually do. And in my position at the Motion Picture Television Fund, we were lucky enough to be working with the AARP Foundation, wonderful team there who we applied for and received a grant to set up a program, a strong, robust social call program reaching the most isolated older adults who were not, using technology. And through that, we decided to invite some of our community partners to a summit just to talk about and basically, share what we were learning so that we could be strong community partners. And through that, our goal was really to inspire and educate other organizations based on the information we had been learning so that they too could launch programs. And what we didn't know was how many people were really interested in this. So ours was really grassroots. I reached out to my network, my colleagues, my Dr. Scott Kaiser, who I worked with. We just invited everyone we knew to the table. We didn't leave anyone behind. And through that, we invited anyone that wanted to participate, that served any community, really. It leaned more towards older adults. And through that, we took surveys and asked the group, what can we provide you most? And hands down, over 80% said we need best practices, we need up-to-date research, we need inspiration and guidance. So we focused on helping them form collaborations and partnerships. And again, we've hosted these summits where we've invited thought leaders to come in and teach us and guide us, and we're continuing to do that. And now we're gaining some momentum and strength and working together, which is really, I think, the most powerful way to make a difference.
I couldn't agree more. And I appreciate you all three sharing your experience and your journey, because naturally this all comes from recognizing need and banding together partners. And Maureen, you started to touch on it a bit when saying that you invited everybody to come to the table. We've seen from the different three of you organizations that Sandra, there's about 20 organizations involved at current with different types of networks, and Emily referenced about 700 different representatives or members, so very diverse. My question to all of you would be, how did you really decide who to invite to the table? How did you get started? Was there anybody that you intentionally left out at the beginning stages? Are there any sectors that are missing? And how has it been working with each of those different sectors, especially the state or the local health departments? So maybe who to start with this time? Let's go, maybe Sandra, could you start?
Sure. The first thing that we did was try to understand who were the organizations and people who are already in the space. And we had a very open mind concept. We came in with the idea that we don't know what the problems are. We don't know we don't really understand the problems. We don't know what the solutions are. And it's going to take all of us to make a difference. Then we began to ask them who do you know in this space who needs to be around the table? And people continue to come to the table. Very much like Maureen's, is a very open coalition, and people are invited to attend our meetings. They're invited to join us in any way that we can, because we realize that it's going to take everyone to solve this problem. So that's the way we handle it. And what was the second question, Matt? I'm sorry.
Just if there are any other sectors that are not necessarily represented who should be, and how your engagement with the state and local health departments has been.
Well, we do have the Massachusetts Department of Health is a member of our coalition, and we work through the individual organizations, especially our age-friendly communities, and getting the local health departments involved. And we know that we still have a lot of work to do that. One sector that we really would like to bring to the table are medical educators, and really beginning to work with them to begin including loneliness and social isolation and addressing that as part of the curriculum for students who are going into the medical fields, because we do feel that we need more assistance on that level, as witnessed by the report that was commissioned by the ARP Foundation to the academies.
I love that, especially the next generation. We need to nurture them and give them the skills and connections they need.
Yeah.
To be able to be
Absolutely.
Emily, can we turn to you about who you invited? How did you get started? Is there anyone missing? And how are you working and engaging the various sectors?
Absolutely. So when we got started, we had about 40 partners at the table. And a lot of them were in the medical community or healthcare providers, which are a very important voice in this work. So they helped us develop our strategic plan, those kind of core partners, because we realized, 700 people in a room is not going to be helpful when creating a strategic map. So we started out with about 40 heavily medically facing. And then we grew from there. We did do in the first year an awful lot of outreach with community-led organizations and trying to get those trusted messengers and community members to the table to provide insight. We purposely did not enter the advocacy ring right at the beginning, because the last several years, so many different things have been politicized, and we wanted to kind of figure out our footing before we started really talking to legislators heavily and putting words behind our work in terms of legislation and so forth. So we purposely steered away from that. Now, however, we are starting work there. So we're working more and more with legislators, with stakeholders that help drive policy. And then with regards to public health, like I said, we bring a lot of public health lens to the table. However, the actual department for the first year of COVID, they were just so underwater. So we allowed grace, and now we have a very strong working relationship with them now that everybody's got their feet under them, and COVID is by no means under control, but at least at the State Department and local departments, they're starting to get in a rhythm. And they recently received a large CDC grant, a data to action grant that we're working closely on. So we have a great relationship with public health now, we're happy to say.
That is wonderful. And Emily, ever so very quickly, are you able to work in all counties in Georgia?
Right now we are in 97, and our state is very odd. Those of you that aren't Georgians, we have 182 counties, I think right now, or 159 counties, 182 school districts. So we're in 97. By the end of the year, we will be in 120.
Wonderful. Thank you for that. That was a direct question posed, but Maureen,
yeah.
tell us.
Yes, so Los Angeles is such a large geographical area, and has a lot of initiatives. So we knew just launching a program, we had to be a little strategic. So at the beginning, like I said, it was very grassroots. We invited our networks, people that had reached out, and then we asked each one of those individuals who needs to be at the table. Who do you know that should be here also? And then we did a little work. We started some partnerships. People actually took actions that we could report on to demonstrate that the coalition and being a member of the coalition had some value. And that's when we started to reach out to government officials. We reached out to the Department of Aging and the Los Alliance for Community Health and Aging, Department of Women's Health, the Department of African-American women, and across the board. And slowly representatives from those agencies, Department of Mental Health, Department of Public Health, started to attend and recognize we were onto something. And that's when I think we started to really gain momentum. We had support of government agencies. We were able to cross-promote our meetings and our activities through these other organizations. But one thing we did do is we did limit who was at the table. We asked that only decision makers attend. We couldn't host a meeting with 700 people or even 200 people. The cost, there was no funding for this at the beginning. So we really asked, if you're coming to the table, we want you to be able to commit that your agency or your organization can actually take steps. And that really elevated the conversation. We had leaders, organizational leaders, and people who represented, government offices attending. And I think that helped us. We invite everyone to the summits and interns and new hires. So we like to distribute the information and help support everyone. But when we have our meetings, we keep it very focused to people who can actually make decisions. And so for us, that's helped. And then now, of course, with having government support, we're able to do more and have stronger collaborations.
Outstanding. And the insights that you all are providing are so valuable. And I hope everybody who's thinking about starting or joining one of these efforts, whether it be a coalition, action alliance, task force, call it what you need, but basically banding together interested parties with a like focus. I hope these gems are being collected and noticed. We have a few questions that have been coming from the audience, and I think with the time remaining, we should maybe turn to some of those. The first one is ever so practical, and it comes, from somebody in Tennessee that says, I see myself as a little fish in a big pond from Tennessee, even though I have many friends and can do many things, but what's the real first step? If you want to start this, is there a certain organization, an entity? Who should be the one who kicks this off? Who should they go to? What should they do? Step one. Maureen, maybe start with you this time. And then
I would like to answer that one, because whoever asked that question, you are the person. You have to, someone has to just take ownership of it and decide this doesn't exist. If I go and ask people, it will get kicked around longer. So just start something. If you invite friends over to your house for a Friday night conversation, if it's coworkers, talk about it, write down some goals or bullet points, visualize what you'd like it to be, and then back into who needs to be there, who can support you. And most people are not interested in helping and supporting ideas. So once you do something, people will see there's energy there and they will start supporting you. But I have to say, whoever asked that question, go for it.
Absolutely. And I would,
by the way, this coalition is amazing as well. So much support, so many resources. Talk to Eddie Garcia, or Jillian, and get involved, because you will gain so much information, and that kind of support you can't find anywhere else.
I couldn't agree more. Emily, Sandra, anything to add there before the next question?
Well, I would like to suggest that people contact, especially if they have age-friendly, livable communities and directors, to start there. And lastly, I would strongly recommend that everybody finds their Caitlin Coyle, because there's always someone on a university level who is committed to this issue, is doing research in this issue, and is ready to help mobilize.
Yeah.
And I'll just add one quick resource to start small that we've been using in our different communities and with lots of our partners. I don't know if any of you have heard of civic dinners. They're now called inclusive, but I just put the link in the chat. And it's a framework where this organization helps create a dinner where you can invite stakeholders to talk about a specific topic. It can be a virtual dinner or in person, and it really gets content and connectedness out, and it's an easy first step.
Wonderful resources. And I love it, because who better to ask than you three? So with that said, here's another question that came up that we would love to be able to do. And there's another question that actually just came up about how to fund coalitions. Naturally, banding together people can be very effective in their own rights, but where do you find the funding? How do you synergize and start to activate these initiatives around those funds?
I wish I could answer that, because we're looking for funding as well. We have gotten some funding from our local, our AARP Massachusetts chapter, that's really helping us to kind of look at the research and the work that Caitlin is doing. But at this point, we have had to depend with great pride on the goodness of volunteers from organizations that are making the difference. And so that's how we've gotten started. And it's amazing how much the momentum that we've gained with volunteers who have, in most cases, full-time jobs, but who are committed to this issue and solving this issue in our community.
I'll jump in too and say, we did not have funding to start this coalition. I did a lot of it on my own at the beginning. It was part of my job to be launching a program. And I thought, why not share what I'm learning? Hosting a meeting was not an expensive endeavor. And so, until you actually start trying to launch programs, citywide or countywide, the cost is really about getting together and supporting one another. So there isn't a lot of cost to do that. So I wouldn't let funding be the barrier to getting started. We too are looking for funding. We collaborate, we have volunteers, there are interns at the universities who want to get involved. So there are ways, again, if the idea is great, people come to the table and they are very generous with their spirit. And when we're starting something new like this, you sometimes have to rely on the kindness of those volunteers. And the goal is to grow to where we can be much more inclusive. And then I would think funding could come from local governments and other organizations who want to see this happen. But don't let, again, funding be your barrier. Just get together and you'd be surprised, like Stone Soup. For those of you who know that book.
Absolutely. And I will join in the party and say we too are looking for funding. However, I will say one thing that has been very effective for us is I constantly have small and large proposals in my back pocket. And we've been shopping those around. So whenever, somebody is interested, I immediately have something to share. And in the recent last few weeks, specifically with all of the, American response dollars starting to come down and all of the additional dollars coming down at the state and local level, we've had a lot of folks interested. And I just saw before I logged on, we got another grant awarded that I was not at all expecting, because I think, I think a lot of people are going to be ready to hand out money to those that are ready to spend it. It's just more money than any of us have ever seen. And I think if you're ready with a plan, then you may very well be a quick recipient.
Can I just add, Matthew, that exactly what Emily said, for you smaller organizations that want to do something, being part of a coalition, you're learning, how to do it in a strategic way so that when those grant opportunities are available, you can prove that you're ready. So you do strategize and have your game plan and then start looking for those small micro grants or opportunities to get funded.
And I would just like to add that, getting started does not mean starting from ground zero. There's lots of good programs and ideas that are out there to learn from, to share. And we live by the mantra, it's okay to beg, borrow, or steal, because forgiveness awaits us on the other side.
Yes, yes.
Absolutely. Well, our time is wrapping up, so I really want to be able to thank Maureen, Sandra, Emily, thank you so very much for sharing your insights, your enthusiasm, your successes, and giving those practical recommendations for individuals who want to synergize their communities, want to mobilize, want to make a difference. So thank you so much for these invaluable insights. There has been so much activity in the chat, so resources and links and things that have been being shared. So just lots of resources and lots of opportunities. And I know that more and more questions could go and go and go, but this is our time. Thank you all three so very much for all you're doing and sharing your time today.
Oh, thank you, Matthew, and thank you to the coalition for bringing all these amazing speakers yesterday and today together. It's really been valuable.
Absolutely. Thank you so much.
Thank you.
Thank you all so much, Dr. Smith, Emily Ann, Maureen, Sandra. We're so happy that you're here with us today. And I'm so glad that we planted the seed about funding, because we are going to have a funders panel coming on later this afternoon. So thank you all so much for that. Really quickly, before we have our intermission, we're actually going to hear a few more updates on 2020 commitments to action from Meals on Wheels America and US Aging. So we'll watch those brief updates and then turn it over to Brittany.
Hi, I'm Laura Balazs with Meals on Wheels America.
the national leadership organization supporting more than 5,000 local community-based Meals on Wheels programs across the country through advocacy, education, research, funding, and more. In addition to delivering critical nutrition, local programs provide key safety and wellness checks, forge community connections, and offer programs to foster social connectivity. We call this delivering more than a meal. At last year's Action Forum, we shared our commitment to conducting research to better understand the effectiveness of socialization programming delivered by Meals on Wheels programs, and our commitment to exploring, implementing, and scaling evidence-informed solutions to better address the changing nutrition and social needs of seniors. Since that time, we have designed a research study to compare the effectiveness of 6 Meals on Wheels social connection programs and expect to see the results in early 2022. We have also embarked on a pilot program to complement existing Meals on Wheels socialization programs with data systems, validated assessment tools, and proven creative aging methods to enhance our network's ability to offer meaningful connection opportunities. I am pleased to join with our partners at this year's Action Forum to reaffirm our commitments and to work together to build a more socially connected community.
Hello, my name is Sandy Markwood, and I'm the CEO of US Aging, formerly the National Association of Area Agencies on Aging. US Aging represents and supports the network of area agencies on aging and advocates for the Title VI Native American aging programs. At last year's Action Forum, I shared how US Aging planned to take action on combating social isolation and loneliness through the work of our members and engaged the National Resource Center for Engaging Older Adults, which is administered by US Aging and funded by the Administration for Community Living. I am thrilled to share with you that since last October, we've completed many of the items we set out to accomplish to raise awareness of the importance of social engagement and connect the aging network and community partners to best practices, strategies, and resources to reduce social isolation and loneliness. Our successes have included conducting a large-scale poll of the aging network to get the on-the-ground perspective of the social engagement needs of older adults and the network's needs to address them. Highlights of the findings of the poll were released in a data brief. We also launched the Engaged Innovations Hub to offer highlights and also share a variety of replicable, successful social engagement program examples with the aging network and communities at large. We also offered a variety of training and technical assistance opportunities, including a virtual summit, bi-monthly technical and programmatic support office hours, and monthly webinars, newsletters, and blog posts that provide a range of technical assistance and support to communities launching social engagement opportunities. And finally, releasing consumer-friendly materials that local agencies can co-brand and share to help older adults stay engaged and connected. US Aging will continue these efforts and more as we work alongside partners like CESIL to foster social engagement and connectedness, with the goal of reducing social isolation and loneliness of older adults, people with disabilities, and their important caregivers.
Thank you so much for those. We are about halfway through today's program, and we will now be taking a short intermission. We have my dear friend, Brittany Fleck, with us again to lead us in a virtual chair yoga session during this time. We will reconvene in about 10 minutes, and Brittany, I will turn it over to you.
Awesome. Hello again, everyone. Just queuing up some music. Amazing. All right, so we have a quick 10 minutes today. We're going to just dive right in. If you were here yesterday, I invite you again to change your space, move around, open your window, bring yourself into a different place that you've been sitting in all morning. And then once you're there, all you need is a chair. And just start to close your eyes and become aware of your breathing. Maybe this is the first time all day that you're actually stopping and feeling yourself. Notice the different sensations that are present. Thinking about the weekend, thinking about the week, thinking about all of our amazing speakers. And then taking one hand on your heart and the other on your belly if that feels accessible to you. And aware of the flutter of the belly, up and down, just being here with the breath, allowing it to be exactly as it is. In through the nose and out deep through the mouth. Belly, ribs, chest. Deep breath in, we'll take an audible breath out. So deep breath in. Let the entire week go. One more time, just like that. Deep breath in. An audible deep breath out. Flutter your eyes open and stretch your arms long overhead. Throwing your crown tall and looking up at the ceiling. And then take your left wrist with your right hand and stretch softly over, feeling a nice opening on the left side body. See what's happening to your breath and your shoulders and your jaw as you do this. And then slowly come back to center and change directions, holding the right wrist and stretching over to the left. Stretching long and tall. Then slowly coming back to center and bringing the arms down. Shaking out the shoulders. And then bringing them forward. And then just kind of shaking everything out here. The arms, the shoulders. Moving the body side to side. Feeling your feet planted on the earth. And then bringing the hands to the thigh and just pausing. Noticing the sensation that's present now that maybe wasn't present before. The arms, the chest, the shoulders. Spread all 10 of your toes, all 10 of your fingers. And roll out the neck to the right. Try to keep your spine straight, not curling in as you move your head. Getting curious in all the different ways that you can move it. Stopping at a place that might feel like it needs an extra stretch. And letting yourself just be limp like a noodle. Coming back to center, reorienting, allowing the blood to settle, taking a deep breath, and then going the opposite direction. Not losing your breath. And then coming back to center and kind of just shaking it out in the head. Gently, without any sort of force. Then coming to the wrists, rolling the wrists. And trying to just observe your environment around you, away from the screen. Changing direction of the roll. See if there's something in your space that you can witness and be grateful for a second. Maybe something you haven't noticed all day. And stretching the forearm. And turning the hand down. Opening and closing the fingers. And shaking it out, bringing this hand down to the right thigh, circling the left wrist. And with this awareness, see if there's a place in your body that feels a little bit looser, that maybe you weren't aware of a few minutes ago. Feeling my feet really for the first time all day. Changing directions of your wrist. And then shaking that out. And bringing the hand back down to the thigh. Closing your eyes, scooting back in your chair if that's comfortable for you, or staying up long and tall. Nestling in and allowing the breath to settle again. Becoming aware if there's any new spaciousness in yourself, or just a sense of settling, a sense of gratitude, a sense of peace that perhaps wasn't here a few minutes ago. And then together again, let's take a long, slow, deep breath in. And gently release. One more time, slow, deep breath in. Gently release. And as we go on through the rest of the day, may you remember that we're breathing together in unison as a collective. Hope you have a beautiful rest of the day and the weekend. Thank you so much for having me. I'll kick it back off to Jillian.
Thank you so much, Brittany. That was incredible. I don't know about you, but I definitely needed that deep breath. So thank you for being here with us. I would like to welcome our next presenters in our Community Spotlight segment, program leaders who will be sharing about work being done on the community and individual level to address social isolation and loneliness. We will first hear from Risa Wilkerson, Executive Director at Healthy Places by Design, and Will Crary, Associate Program Manager at the Prevention Institute. Then we will hear from Kasley Killam, CEO and founder of Social Health Labs, alongside Dia Miller, community organizer, digital designer, artist, and recipient of a Social Health Labs microgrant. Thank you for being here. And Risa, I will first turn it over to you.
Great, thank you, Jillian. I want to make sure everybody can hear me. Can you hear me, Jillian?
Yes, we can hear you great.
Okay, thank you. So pleased to be here with all of you and sharing this time to talk about socially connected communities. And what we want to do is I'll take just a few minutes to share about a report that Healthy Places by Design was co-created and how it came to be. And then we'll be talking about some community examples. So in 2020, we convened a group of about 60 practitioners, leaders serving diverse populations in equally diverse settings, who co-created a set of resources, the report you see on the screen, and 2 action guides. This was as a result of a series of conversations where we talked about the difficulty of addressing social isolation during COVID-19 especially, when all of the gathering places that are typically the antidotes to social isolation had been closed, and how social isolation was being discussed and addressed almost primarily at that point from an individual lens. We've heard throughout the day, yesterday and today, how that is changing, and we're super grateful for that. What we did together was talk about how could we address the root causes of social isolation at a very local level. And together we created 5 recommendations. These recommendations are intended only as starting points to generate conversation and ideas for addressing social isolation from a sector level and across and in place-based situation. So you can see on the screen that we came up with 5 recommendations. And our hope is that these recommendations and the report and guides will inspire and equip all readers to really intentionally redesign community level systems to support meaningful social connections. So you can see the first 3 there are sector-based. The first one looks at public spaces, the second are transportation systems, and the third, housing environments. The latter 2 are really looking at practices and norms that we believe should be integrated no matter how you're addressing the issue. So inclusive practices and community-led solutions, as well as social connectedness as a community norm. Why did we choose these first 3 sectors and not other sectors? Primarily because we wanted to have, think about this from housing being an anchor point of our lives, and knowing that when we walk outside of our homes, we immediately encounter the transportation network, and very shortly thereafter, the common spaces where we can come together with folks that we know or even don't know as well. We know that our public spaces and our transportation networks connect us to all the other determinants of health, like healthcare systems, social services, education, and workplace environments, and more. So that's why we started here. And again, this report is a, idea generating, we hope, an inspiring kind of report where you can think about how this could look in your own community. Lastly, I want to mention that the report has some guiding principles. And so we based everything written in here on the idea of asset-based approaches, recognizing and honoring history and historic and community culture, and also equity and inclusion. So everything you'll see in here was generated and thought about and written about from those lenses. If you haven't already read the report, I hope you do so, and that between the report and the examples that you're about to hear, the ideas will begin to flow for how you can address social isolation in your community. I'll pause there because I'd love to get into some community examples and invite Will to join the screen, and we can go to next slide.
All right. Thank you so much for that introduction, Risa. Hello, everyone. My name is Will Crary. I work with Prevention Institute, and I'm really excited for this opportunity because this report hits home for me as someone who has benefited from public basketball courts, thoughtfully planned bike lanes, and in a past life, I was a farmer's market manager. So really excited by this report. And I'm going to talk a little bit about Making Connections, which is an initiative that Prevention Institute helped design and coordinate, a 5-year community of practice with 13 coalitions, multi-sector coalitions across the country, very diverse geography, diverse organizational partners in each of the 13 coalitions, and different populations of focus as well. So we intended this work along with the foundation Movember, who guided this project, to impact the mental health and well-being of men and boys with specific prioritization of populations that experience high levels of trauma. And along with high rates of trauma, we found that a major risk factor that determined mental health outcomes were these notions, really limited notions of masculinity that socialize men and boys towards isolation. And so the principles underpinning the Making Connections initiative align really closely with the 5 recommendations from this report. And I especially want to highlight the last 2 about community-led solutions and connectedness as a norm. both of which were driving values, not just of the outcomes and strategies of these 13 coalitions, but also the assessment and the planning phases. So in those early assessment phases, the first year of the work, we encourage the coalitions to understand that the underlying causes of disconnection, underlying causes of trauma, the roots of mental health challenges were extraordinarily important, like those first 3 recommendations we see in this report. And we wanted destigmatization of mental illness to be a big piece of the work, but not just on an individual level. And so we were supporting the coalitions identify community level factors that support connection with their peers, connection with their community, and connections with their culture. So really thinking about changing the environment and changing structures, not just changing people. And so on the next slide, I'm going to get into 3 different examples here. This first one is in San Diego, California, and the San Diego Coalition was led by a group called United Women of East Africa Support Team. And along with their community partners, they are a pillar in the City Heights neighborhood of San Diego, which is home to the largest population of Somalian refugees in California. And so in the simplest terms, what they try to do is support a thriving East African community. And in doing this, they've reflected on the collective trauma of leaving their home countries and how that's created disconnection from the social, disconnection from the cultural and economic opportunities that aren't immediately available in their new communities. And so they prioritize social connection and addressing mental health equity after seeing too many young men in their community either die by suicide, using substances to cope with their pain, or brushing shoulders with gangs that presented opportunities for connection, opportunities for financial stability that we know are critical for thriving young people, but otherwise may not have been structurally supported in the community. And of course, all of this is connected to a lack of opportunity rooted in structural inequities, systems of oppression, racist policies that have led to this concentrated disadvantage. And so one example of the natural opportunities for connection in their community are the mosques. And so they convened faith leaders to support them address post-traumatic stress disorder, depression, and suicidality, really to push back against social norms of ignoring stress, ignoring trauma that many of them have experienced, but moreover, supporting the faith community see its role in strengthening connection as a public health and as a mental health strategy. And one of the most meaningful opportunities for connection that we identified in their work is presented when the young men came together to support a strategic planning process, which you see in that photo on the left there. And while it started as and they decided that they would create a hub for young men to come together, and it became a hub where they could convene to do leadership opportunities, but they were also authoring op-eds. They were presenting on community resilience at national conferences and supporting community demonstrations like the one you see there. So connection as this idea of collective efficacy and having the opportunities and resources to take action together. And on the next slide, I'm going to try to move quickly here because I have 3 that I really want to share with you all. Really quickly, just to say that a similar hub was created on a community college campus in Kankakee, a different population that experiences high rates of trauma. They were focusing on veterans and veteran students specifically. And so veteran students came together because they were realizing that campus could feel alienating for them, not feeling a sense of belonging, feeling isolated from peers who maybe weren't clear on what experiences they had before school, and being a part of a community that wasn't nurturing to their strengths. And so this was a particularly important project because we know that veterans experience suicidality at a higher rate than a lot of other populations. And so they participated in some research and strategic planning on their campus that really was led by the student veterans, where they identified the need for a safe place for them to come together that required their ingenuity, their lived experience to determine what would be the best opportunity for them on campus to feel connected. And so ultimately they got to make a lot of decisions around what elements went into this student center, But what was so amazing is that what started as a one-off effort to generate connection on campus transformed into really system-wide change on the college level, where policies were being shifted to be more inclusive, not just of veteran students, but of BIPOC students and other historically excluded and marginalized groups. And this last example is maybe the one that resonates the most with this report, because it speaks directly to that second recommendation to prioritize connection in transportation systems. And so the Making Connections Coalition in Albuquerque is led by an organization called Together for Brothers, which is a community organization led by young men of color. And so starting in 2016, the young men of color actually led a community organizing effort to advocate for transit equity. And they chose to focus on this public transportation topic after doing a transit audit and a health impact assessment, which you see on the left there. They got to create very cool zines and infographics. So like the young men in San Diego, part of this effort was about the collective efficacy and the opportunity to make substantial change in their community. And so they recognize that a lot of the families and young men of color in their community are transit dependent, not only for everyday needs, but it would impact their mental well-being as well, because transportation, safe and affordable transportation, were a necessary means for financial stability, as well as one young man was citing how without public transportation, he wouldn't be able to stay connected with his grandmother. And I thought that was really sweet. That resonates with me. And so after participating in public hearing meetings, advocating with other city groups, and partnering with the mayor's office, they actually secured free youth bus passes for all Albuquerque residents under 18. And this is something that they're going to try to extend to the entire city. So the advocacy is continuing, and we see that these young men, when given the opportunity to lead and to envision what their community can look like, can really affect positive change that impacts connection. And this is why I love this report so much, because the recommendations can really support other communities in understanding how to prioritize connection in a way that reflects health equity and racial justice. And I can maybe pause there and pass it back to Risa.
Thank you, Will. What I'm hearing are a number of things that say that safe spaces are really important, that those spaces need to be co-created with the folks who really need to use those or want to use those, so that we're sure that we design them in a way that meets needs and helps people to feel welcome. I'm also hearing that this is a virtuous cycle. Once people feel welcome, they feel seen and heard for who they are, then they're more likely to engage. And the more engaged they are, the more inclusive it feels and the more social connections they have. And that you truly, when we create safe and social spaces for everyone, all people benefit. Thank you so much for those examples, Will.
Absolutely. Thank you for inviting me to this space.
And now it's my honor to turn the Zoom microphone over to Casley Killam.
Thank you so much, Risa and Will, and thank you to everyone at the Coalition and Foundation for facilitating this conversation and for the opportunity to share some examples of alleviating loneliness at community and individual levels. So the first example that I'd like to share, if we go to the next slide, is from the Community Living Campaign. This is a nonprofit that was founded in 2007, whose mission is to help older adults and people with disabilities to age and thrive in San Francisco. I've had the honor of being involved with the Community Living Campaign as a board member for the past 4 years, and we lead a variety of different initiatives: community building events, technology, access and literacy training, food delivery programs, advocacy, and much more. One of the initiatives in particular that I wanted to spotlight today is our award-winning Community Connectors program. The goal of this program is to turn strangers into neighbors and neighbors into friends, which I absolutely love. It was one of the reasons that I was drawn to the organization a few years ago. So in 13 neighborhoods throughout the city, as you can see on the map here, we have different community connectors who are local residents who coordinate a range of virtual and in-person activities, as well as outreach for older adults and people with disabilities in the community. If we go to the next slide, to give a bit more detail on this, some of the programming that's involved is offered in multiple languages to meet the needs of different residents, and it ranges quite widely. So the activities are related to exercise, nutrition, writing, art, history, music, volunteering, and much more. And during the pandemic, like many organizations, we had to really pivot. Most of our programming before that was in person, but we were able to offer over 100 hours each month of virtual and in-person activities where safe. We got really creative with new ways to stay in touch, like walk-in waves, wellness calls and visits, mailing out different resources and activity calendars by both mail and email, and so on. And I think what's really important to note about the Community Connectors program is that all of the programming related to this is developed for community members by community members, right? This is all very grassroots, it's volunteer-led, it's hyper-local for the neighborhoods that these residents live in. And the Community Connectors themselves are neighbors. They live in those neighborhoods and are taking action and initiative to connect people locally. Even if you go back to the foundation of Community Living Campaign, our very founders were local residents and advocates who saw a need and make it happen. So the solutions that have come out of this are hyper-local and really tailored to the needs of local people. If we go to the next slide, like was talked about yesterday and earlier today as well, I think it's really important to be generating evidence and data to show the effectiveness of programs like this. And so I'm pleased to report that as a result of the community building programming that we lead, 84% of our participants know more neighbors who they feel comfortable asking for help if they need. 93% report that they are less isolated, and 100% of our participants feel more engaged with their community. So we're really proud of these numbers. We've seen over the last decade and more the impact of this community program, and we would love to partner more with researchers. I think bridging some of the data that we're able to see with boots on the ground in the community and working together with academia to make sure that we're sharing those insights and feeding in a bi-directional way, I think is really important. So if we go to the next slide, I wanted to also share an example of an individual effort to alleviate social isolation and loneliness. So as you can see here, this is a monthly microgrant program run by my organization, Social Health Labs. So with support from the Wellbeing Trust, earlier this year in January, we launched this program to support community builders across the country. So each month we give out $1,000 to an individual who has an idea to connect people in their local neighborhood, but maybe needs a little bit of support to make that happen and to get that off the ground. So Social Health Labs is really all about experimentation with connection. So we use language like you see here, belonging biologist, connection chemist, friendship physicist, to kind of tie into that theme and really have fun with this idea. So if we go to the next slide, since launching in January, we've awarded one microgrant each month to the individuals that you see here. And their projects are quite diverse and really creative and interesting. They include creating a shared community garden, hosting craft making gatherings, making supportive cards for kids at local hospitals, and even building a picnic table and benches in a public space for people to gather. So really creative and unique to each of these communities. The individuals themselves are also quite diverse in age. You can see Sydney there in the center, who's 7 years old and is leading a project in her neighborhood. They're also diverse in race, ethnicity, background, location, and many other dimensions. But the really common theme is that each of these individuals feels inspired to take action in their local neighborhoods and to build relationships in a way that's really meaningful to that place. And I'm very pleased to share that we have one of the microgrant winners, Dia Miller from Ohio, here today to share more about her project. So Dia, I'd love to invite you on, and we can go to the next slide as well. All right, so Dia, to start off, tell us a little bit about your neighborhood. You live in Norwood, Ohio. Tell us about the history there and what it's like living there.
Hi everyone, I'm Dia Miller. So Norwood is located in the city of Cincinnati. So it's a city within a city. It's a walkable community with a central location in the metropolitan area of Cincinnati, but it's also your typical Midwestern town. You know, it used to be a prosperous middle income community until companies left the city around 1970s. So it had changed the way the city is run for the last 5 years. Improvements have been very slow in our cities and parks. So yeah, that's where Norwood is. And I've been here for 8 years. A lot of people are like our family. We are new in Norwood, but some people have been here for a while. We have a cluster of Middle Eastern immigrants in the northern part of the city as well.
Great, thank you so much, Dia. And so tell us a little bit about the project that you've been running with support from the microgrant and kind of what the inspiration for it was.
So my project is building an inclusive map for Norwood. It will be included in the welcome bag. The idea of a welcome bag came from a community forum that we started about in 2019. Right now, it's its own nonprofit organization called Norwood Together. I had such a great experience here as an immigrant and a new community member, and I just wanted to share that with other new people in Norwood. How do we communicate the things that this town has to offer, not just its bad reputation? So that's what the welcome bag is. A neighbor would be asking for a welcome bag for their neighbor. And what's in it, it's information of what's going on in the city, services, events. And in the beginning of the pandemic, we had masks also in it. So I've been thinking about adding, how do we make the welcome bag better? Where can these new neighbors meet their neighbors that's already here before, right? So we have questions that we ask to the residents. What are the special places in Norwood that you think new neighbors need to know? And we have some quite interesting answers, oh, that magnolia tree over there, or this is where we walk our dogs. So the idea is that new neighbors can have a cheat sheet where to meet other neighbors. And our map will be donated to Norwood Together, and it will be included in the welcome bag.
That's really wonderful.
So thank you, Kathleen. It was really great. So at the beginning, we had a plan to create 4 different events where we can meet neighbors. It was called community council meetings. However, I heard that it wasn't, well attended, so we kind of pivoted into other venues. So we meet people where they are. So we went to the libraries, and then we also found out that the neighborhood is organizing a welcome dinner for new immigrants. So we sponsored that instead. So yes, a little bit pivoting here and there, but we have gathered all the information, and soon the map will be ready.
I love it. It's so creative and a really special way to make people feel welcome and to start building those relationships when they move to Norwood. That's really neat. So I'm curious, Dia, your thoughts on kind of how those of us who are tackling social isolation and loneliness in all these different ways, but really want to make sure that we're empowering individuals like you who feel inspired, have an idea to take action. How would you recommend that we can help do that and really support people like you in this kind of work?
I'm so glad to hear all kinds of different background and people who have their ideas and were granted this grant. And I think without this grant, my idea is just an idea. I'm already busy. I have my full-time job and family. So this is just a nudge to make that happen. It helps also bringing community together. The sponsorship that we've given to the welcome dinner, it was excellent. And so yeah, I appreciate this kind of, this is like the grassroots of the grassroots, right? You don't have to go to any 501c3. You have an idea, let's help you make that happen. So I think this is a great opportunity, and I think there should be more of grants like this to communities.
Well, thank you so much, Dia. And I think also, you know, a lot of projects that people have ideas for don't necessarily need funding too. And I hope that people watching this come away also with the takeaway that it's really incumbent to all of us to take action in our communities. It can be as simple as being more friendly with our neighbors, reaching out to individuals who might be isolated, and really taking it upon ourselves to own this issue and to create the social norms that we want to exist in our communities. So thank you so much, Dia, for sharing your story and example with us. And with that, I'd like to, we can go to the next slide to close up. Feel free to get in touch if this is of interest to you, but I will hand it back over to Jillian, and thanks again.
Thank you so much, Kathleen. Thank you, Dia. Thank you, Risa and Will, for not only being here with us today, but also for the amazing and inspiring work you do in your communities to continue to make us feel more connected. I also want to drop a quick question in the chat. I think my colleague Rachel is going to do so. Wondering to hear from you all. Where do you feel most connected in your own communities? We would love to hear some thoughts, and I'm happy to read out some of the answers for everybody. And a lot of the resources that were described by Risa and others today, we'll make sure to share those on our website, social-connection.org, in the next couple of days here. Great, as those are coming through the chat, I'm going to turn it actually to hear from more commitment updates on commitments to action from last year. So we're going to be hearing from Humana as well as the American Psychological Association with updates from their commitments to action pledged at the 2020 Action Forum. So I will turn it over to hear from Humana.
Hey everyone, I'm Katie Holcomb from Humana's Office of Population Health. Like everyone else, Humana had a busy year and fulfilled a lot of commitments to action in 2020 and 2021. But one of our major commitments to action for the coalition was our Far From Alone initiative, a public health awareness campaign that brings together partners committed to addressing loneliness and social isolation and promotes resources to help people feel more socially connected. A few highlights on what we've done. A big part of any public health awareness campaign is really building a community that starts conversations and helps influence change. To date, we have had over 25 organizations partner with Humana on Far From Alone and work together with us on campaign communications. Around the same time as last year's Action Forum in 2020, we launched a revamped website, farfromalone.com, enriched with resources, research, and inspirational stories from organizations making a difference in addressing loneliness. Among the stories in the past year, we had the amazing opportunity to interview 4 astronauts through USA Today's Storytellers Project and hear their firsthand experiences with loneliness in space and what we can all learn from them in our everyday lives. We also launched our social media channels on Facebook, Instagram, and Twitter. We encourage you to follow us at Be Far From Alone on these channels. So what's our next commitment to action? Well, now that we've achieved awareness of Far From Alone, our next goal is to leverage our campaign to take more action. A couple key things we can plan to do. Increase our efforts on targeting individuals experiencing loneliness through social media engagement from our partners and through local community activation. Second is we can loop in physicians and clinicians to share Far From Alone as a resource for their patients and their families, and allow physicians to provide feedback for enhancements. Humana is so proud to be part of the coalition in this year's Action Forum. We are all truly making a difference together and bringing a much-needed spotlight on loneliness and social isolation. We encourage you to visit farfromalone.com and join us in this campaign, or simply share the website with your loved ones to help anyone experiencing loneliness. Thank you.
Hello, I'm Catherine McGuire, and I'm the Chief Advocacy Officer for the American Psychological Association, which is the leading scientific and professional organization representing psychology in the United States, with over 122,000 members. The APA is a proud member of the Coalition to End Social Isolation and Loneliness, and we appreciate the opportunity to report on our commitment to ending social isolation and loneliness. Social isolation has been linked to adverse health consequences, including depression, poor sleep quality, impaired executive function, accelerated cognitive decline, poor cardiovascular function, and impaired immunity at every step of life. For these reasons, APA is committed to doing all that we can to help those who suffer from social isolation and loneliness in order to benefit society and improve lives. An effective response must ensure those impacted by social isolation and loneliness have adequate access to mental health services. Technologies such as telehealth can provide access to important information and resources for those who experience social isolation. Last year, we as an association made a commitment to utilize psychological research to inform and shape a national policy strategy and public education campaign to combat social isolation and loneliness. We committed to apply APA's expertise in behavioral change and social determinants of health to the area of social isolation and connectedness. And we committed to advocate in collaboration with the coalition for increased funding for research to fully understand the pathways that link social isolation and health. To accomplish these commitments, first, with the inclusion of psychologists on the coalition's scientific advisory board, the psychological perspective was incorporated into the coalition's work to educate the public and policymakers. Second, we worked with the Elder Justice Coalition to support funding for social isolation and loneliness. The Elder Justice Act reauthorization includes $250 million for programs to address social isolation and loneliness. The House Ways and Means Committee recently recommended that the House Budget Committee include the Elder Justice Act reauthorization as part of its House budget reconciliation package before going to the House for a full vote. We have also continued our advocacy for maintaining the critical expansions in insurance coverage for telehealth and audio-only services that have been made in response to the COVID-19 pandemic. We look forward to the continued partnership and using science, psychological science, to end social isolation and loneliness.
Thank you so much, Humana and APA, for those great updates on their commitments. Before we had them join, we did ask in the chat, where do you feel most connected in your own community? I'm just going to read a couple of these off because they are so great to see. Pat said, in my neighborhood on top of a mountain. We heard from Margaret, National Night Out is a big deal in her neighborhood. From Risa, my neighborhood street where I continue to meet new people. Barbara talked about classes at the local community college program for older adults, which is now over Zoom. And Will added information about his beautiful park near his house where they have basketball courts, soccer fields, etc. A great place to play and connect with others. So thank you for continuing to put those in the chat. It's great to see places that people feel connected. And that brings me to the next session here, investing in a more socially connected future. We will hear presentations by the National Institute on Aging and RRF Foundation on Aging on how organizations can obtain the necessary funding to deploy programs in their own communities. So please join me in welcoming Dr. Elizabeth Necka, Program Director for the Division of Behavioral and Social Research at the National Institute on Aging, and Ruth Ann Watkins, Chair of the Board of Trustees at RRF Foundation for Aging. Dr. Necka, I will hand it over to you first.
Thanks. It's nice to speak with you all today. So I wanted to speak with you today about the National Institute of Aging research priorities, our portfolio, and funding opportunities. And I am housed within the Division of Behavioral and Social Research at the National Institute on Aging. Next, please. Next. The NIA supports and conducts genetic, biological, clinical, behavioral, social, and economic research on aging. Our mission is to foster the development of research and clinician scientists in aging, to provide research resources, and to disseminate information about aging and advances in research to the public, healthcare professionals, and the scientific community, among a variety of audiences. Next. As you'll see here, I've taken our strategic plan and I've made it into a word cloud. And I want to draw your attention to two words that stick out and are particularly relevant for our audience here today, one of which is social and the other of which is interventions. So at the National Institute on Aging, we support a wide variety of research on social factors that influence health and well-being and aging in late life, as well as interventions that can target social connections and social isolation to determine downstream effects of those interventions on health and well-being. Next slide, please. I'm housed within the Division of Behavioral and Social Research at the National Institute on Aging, which supports most of our social, behavioral, psychological, and economic research on the processes of aging at the individual and societal levels. This goes from genetics to cross-national comparative research and basic through translational research. We support research on social processes at the dyadic level, including family and interpersonal relationships, as well as biobehavioral research on the mechanistic pathways that link social and behavioral factors to health in midlife and older age. Our research priorities also include studies on interpersonal mechanisms in early and midlife that influence late life outcomes and trajectories of aging, particularly as these relate to later life health inequities, as well as research on the science of behavior change. So how do we get people to change their behaviors and maintain behavior change? And finally, mechanisms by which social isolation and healthy social relationships impact aging outcomes. Next, please. So recent research funded by the National Institute on Aging demonstrated that loneliness is associated with increased dementia risk independent of other factors. So you can see here that gender, race, and ethnicity, education, and genetics have an impact on risk of developing dementia, behavioral risk factors, depression, and actual social isolation. Above and beyond these, loneliness is also a predictor and is associated with a 40% increase in risk of dementia across the 10-year period. Now, this is one of many studies that is demonstrating this, but I think what's compelling here is that this research demonstrates that loneliness is an independent risk factor and really suggests that we need to be supporting work to understand how this is associated with an increased risk of dementia and how we can tackle this problem. Next, please. So here's a list of projects that we support here at the National Institute on Aging. This is publicly available information that I encourage you to check out on reporter.nih.gov. Our research portfolio includes projects on volunteering and other interventions to reduce loneliness in late life, as well as research to understand how it is that loneliness impacts Alzheimer's disease, health, and well-being across the lifespan. We also include in our portfolio research to address how we can use virtual technologies to enhance social engagement in older adults and across the lifespan, as well as research on social networks and loneliness in different settings, including the community settings, as well as nursing homes and homeless shelters, where the social networks may be different than they are for those who are living in the community. Next, please. We recently supported research through a funding opportunity entitled Biopsychosocial Factors of Social Connectedness and Isolation. The purpose of this funding opportunity was to seek projects that explain underlying mechanisms, processes, and trajectories of social relationships, and how these factors affect outcomes in human health illness, recovery, and overall well-being. We supported 3 different projects through this funding opportunity, including research looking at cultural factors and resilience in a Native American tribe that are associated with social connection, how social connectedness promotes cognitive health in late life, and how social connection within residents of a nursing home, as well as with their outside connections, such as their family and friends who live outside the nursing home, impacts health and well-being and changed as a function of the COVID-19 pandemic. These are just a few of the projects that were supported through this funding opportunity. These were all supported by the National Institute on Aging, but over 15 projects were supported across the National Institutes on Health to study these factors of social connectedness and isolation. For instance, in other populations, such as moms in the perinatal period, as well as individuals who might be at risk for mental health disorders. Next slide. The future directions of the National Institute on Aging's portfolios with respect to social isolation and loneliness are listed here. These are recommendations from our external advisory councils on directions that the National Institute on Aging should continue to support and should take our research priorities, including a focus on behavior change interventions on older adults and behavioral issues that are specific to them, including social isolation. Research that can identify social factors that can be modified to prevent Alzheimer's disease and related dementias and enhance healthy cognitive aging, and research on the influence of dyads, families, and other small social group interactions and networks on health. Next slide, please. Here are a list of open funding opportunities at the National Institute on Aging. You'll see that some of these are directly related to research on social isolation, and others are focused on other factors such as social factors in COVID-19 or in changing behaviors, health behaviors to prevent mild cognitive impairment and Alzheimer's disease and related dementias that are encouraging projects that will address questions related to social isolation. One that I want to call your attention to is Pragmatic Trials for Dementia Care and Caregiver Support, which supports projects that would be administered at large levels in the community that are interventions to address some of the issues that face dementia caregivers, including issues of social isolation. Also, the funding opportunity that I recently mentioned, where I showed you the 3 projects that had been funded on biopsychosocial mechanisms of social isolation and connectedness as they relate to health, was reissued 2 days ago. So we are still soliciting applications that would address the issues in that funding opportunity. Next slide, please. To get involved in research, we highly encourage you to check out our blog and subscribe. It's Inside NIA. There you can find out more about the latest scientific findings from NIA-supported research, as well as funding opportunities where you might be able to develop applications for research projects that National Institute on Aging can support. If you are planning on developing research projects and soliciting NIA support, I would encourage you to contact a program officer who can speak with you about National Institute on Aging's priorities in this space. And if you'd like to learn more about the research that we're supporting, I encourage you to reach out to our NIA press team. Thanks so much. And I'm now going to hand the mic over to Ruth Ann.
I'm Ruth Ann Watkins, as you know, and I am with the RRF Foundation for Aging, which is located in Chicago. And so with these minutes that I have, I'm going to tell you a little bit about what we fund and how you might approach the foundation with inquiry about possible funding in relation to isolation and loneliness. We are a private foundation, and as I mentioned, we're located in Chicago, and we fund other not-for-profit organizations that have a 501c3 tax status, or foundations that are not-for-profit but are not required to meet the IRS tax requirement of 501c3. We have been in existence for over 40 years, and we're one of the first foundations, private foundations, established exclusively dedicated to issues of aging. And over those 40 plus years, we have given over $250 million in funds to address the issues people who are aging face. So we've had a lot of experience in dealing with the issues of aging, which have changed in some ways and which have not changed, but certainly the issue of isolation and loneliness has been exacerbated with the pandemic. 2 years ago, a little over 2 years ago, we did a strategic plan. And at that point in the strategic plan, we identified 4 priority areas for funding going forward. We did this, one of the reasons was that we wanted to increase the impact that our funding would have on issues that we chose to support research or direct services for going forward. We're a small organization. We're considered a mid-sized foundation. We have a staff of 9 knowledgeable, passionate staff, passionate about making a difference in the lives of older people. And we have a board of 9 trustees. We meet 4 times a year together with the staff, and it's the trustees that make the final decision on funding. The 4 areas, priority areas that we chose were caregiving, financial security in later life, housing, and social and intergenerational connections. And there have been a lot of exciting things discussed yesterday and today in relation to approaches and ideas, creative ideas to address the issues of isolation and loneliness. One of the things that also is a recurring theme that we've been hearing is that we need to be able to measure and demonstrate that the things that we're doing indeed actually work, and particularly getting to the level of the individual as well as the community. With our social isolation and multi-generational connections, there has been evidence that intergenerational programs do have a positive effect on eliminating or lessening loneliness and isolation. So how do you go about getting a grant for the idea that you have that you want to put forward and try in relation to isolation and loneliness, whether it's an innovative research project, whether it's an advocacy project, whether it's a direct service project, or an educational and training project. So the first thing you do is you go to the website, and I would recommend this that not just for our foundation, but to any foundation if you're thinking about approaching a foundation for the funding. Because a website tells you what the particular foundation is interested in funding. It tells you the calendar of the activities, whether, when grants are submitted, when the funding decision is made, and who makes that. And also whether or not you can apply what we would call a responsive grant, where you just submit a grant proposal to the foundation, or whether you're required to do a letter of inquiry. And in our case, we recently decided that a letter of inquiry is required before a full proposal will be accepted. And when you submit the letter of inquiry, it is reviewed by our program officers, and the decision is made of whether or not it appears to be a topic that would be of interest in the foundation funding, if it has potential for impact in making a difference in isolation and loneliness, and if it is a project that can be duplicated or replicated, depending on, and if the idea is, fully developed. So depending on what the decision is, an invitation to submit a full proposal may be sent to the person who has submitted the LR, letter of inquiry, or there may be a letter that goes to the person saying that an invitation is not going to be extended for funding. The other thing you find on our website is you will find the evaluation guidelines, and you will find the what is required for dissemination, the types of reports that are required. If we fund both on a individual 1-year basis or multi-year basis, and during that period of time, whether it's a 1 year or multi-year, you will know that you will be expected to submit a progress report and a final report where we're interested in what the findings have been, whether it's been successful or not successful, the lessons learned, and how you plan to disseminate your findings. Now, this is another area where we've increased our emphasis, is that we want to be able to get the findings out where they make a difference, the lessons learned, so that it gets down as far as the individual person who is suffering with isolation and loneliness, to the people who are providing the services or training people. And we've heard that theme over the last 2 days too. It must get to the people who are making a difference. And so the other thing is that you would need to know is that there's a program officer that follows you through your whole grant cycle if you've been given the grant. And the program officer is a resource for you. And they're very, very valuable, very committed. We do fund on both a local, state, and national level, but we only fund in the United States. We do not do foreign grants, as some foundations do. So here we are as a foundation that is committed to solving the problems of aging in this country. And the issue of isolation and loneliness has only grown over the years, and has something that we have great interest in. As you know, we've put it as a priority area. So I would urge you to contact the foundation with an idea. One of the people who presented earlier carries around a little pocket full of ideas, so that's a good idea. So the foundation is committed to this topic, and we welcome your inquiry and your commitment. Thank you for this opportunity.
Thank you so much, Ruth Ann. And thank you, Dr. Necka, for those very informative presentations, for being with us here today, and for recognizing the need to fund programs to combat this critical issue. I'm excited to introduce our next segment, which is the Connection Through the Lens of Technology, convened by Aspen Digital. We understand technology plays a critical role in social connectedness, and I'm pleased to welcome Christine Gloria, Director of Artificial Intelligence at Aspen Digital, to moderate this important panel discussion today. Our panelists include Dr. Emily Weinstein, Senior Researcher at Harvard Project Zero, Ireti Akinrenade and Joan Mukogosi, Research Assistants at Data and Society, Vaishnavi J, Head of Safety and Wellbeing at Instagram, and Ayman Hariri, Co-founder and CEO of Vero. While we will not have time for live Q&A today, we do welcome you to use the chat respectfully with any questions that we might be able to get to our panelists afterwards and catch up with you all after via email or through our website. Thank you all for being here. And Christine, I will turn it over to you.
Amazing. Thank you, Jillian, for such a warm welcome. Hi, everybody. As Jillian mentioned, I'm Christine Gloria, Director of Artificial Intelligence with Aspen Digital, a public policy program of the Aspen Institute. Our work centers on empowering industry, academics, researchers, lawmakers, and other members of civil society to be responsible stewards of technology. And I am delighted to make space for and share in this discussion with all of you today. As Jillian mentioned, the conversation today, we're going to explore this intersection of youth well-being and technology. And I think we all recognize that to some degree, our mediated digital interactions have an effect, good or bad, on our mental and emotional well-being. And I recognize there has been a lot of attention in the news lately about this, and trust me, we will get there. But I really kind of wanted to start off by by laying down some groundwork with this wonderful set of experts we have available at our disclosure. I think one thing to note is, the research in this space indicates this relationship between technology and youth to be, well, complicated, right? Pew has released numbers over the past couple of years where 81% of teens say that social media makes them feel more connected to what's going on in their lives. And then on the opposite end, 45% say they feel overwhelmed by the drama that they encounter in social media. So I think there is a lot of questions here that we'd like to unpack. And I really want to kind of start off with Emily over with Project Zero, who's been studying the space for a while, and just would like to hear your thoughts on, how do youth perceive their connection with technology, and to what extent does that impact their relationship to it?
Thanks, Christine. And I really appreciate the Pew data that you just referenced to tee up our conversation. My team at Project Zero recently finished analyzing some of our own data from over 3,600 youth on their perspectives and worries about growing up with today's technologies. And one of our most important findings is that teens aren't monolithic and their tech experiences don't happen in a vacuum. We all know this, but it's just so important that youth have different strengths and vulnerabilities and circumstances, and their experiences with tech differ in really important ways as a result. So practically 1 hour on Discord may directly support feelings of connectedness for a teen who feels isolated at school, but uses tech to stay close with his camp friends or cousins. And for another teen, an hour on the exact same platform may be filled with name calling from supposed friends that leads to feeling inadequate and isolated. And it's not just either or, like tech is either making a teen feel connected or it's making that teen feel isolated. It can be both at different moments. And I think because it varies by teens and for individual teens, we found there's just so much power in starting by asking teens open-ended, pretty simple questions like, when does tech make you feel most connected? And when does it make you feel most lonely? Which really intentionally open up more nuanced conversations and create space for them to actually share the good and the bad with us.
That's great, Emily. I think it's wonderful to kind of hear that there's complexity here, because I think so much of what we do, particularly from the science realm, probably flattens a lot of that. And to that, I would love to hear from Arati and Joan, who have really spent some time here figuring out the nuances of this relationship, and specifically, the work that you guys have produced. What are some of the hot takes that you would give to developers and lawmakers that really need to understand this relationship and this nuance? How would you approach that with them?
So thank you for that question. And I will say we're so happy to be here, so grateful to have this opportunity to talk about our work. And I will say first, to sort of build on this sort of idea of complexity that teens have with their relationship to technology. In our Unseen Teen report, we saw that young people definitely define their experience with technology in a number of different ways. And one of our respondents talked about, their experience speaking with a young person about their digital well-being. And the young person basically said that there's no such thing as digital well-being, that it's really just their well-being in general as a whole. And so we might imagine digital well-being to be something that describes our relationship with technology. But teens actually view the line between their virtual and non-virtual world as really blurred and sort of porous. And so just to say, this is one of the reasons why it's so difficult to define and operationalize concepts like well-being for and connection for teens online. And I think that's something important to hold when working on this topic.
Thanks, Joan. Areta, do you have any additional thoughts you'd like to add into that?
I do. I want to make sure that we get to your specific question, but as Joan said, blurred and porous is the perfect way to describe how teens perceive their connection to technology. Like they have this understanding that their offline emotions impact their online behaviors and their online behaviors and environments impact their offline experience. But the distinction between the two isn't really important or meaningful because their digital and real lives are just so intertwined. And I understand that we're talking about social isolation or connection, but I think digital well-being as a whole is really relevant here because it's not just your social connection, it's also thinking about digital hygiene. What's your digital footprint? How many tabs do you have open? How do you organize everything that you've consumed and hope to retain? And what we've described and what we're talking about is this practice of like strategic, engaging in strategic knowledge, which Joan and I have been working on to understand how teens and people in general's understanding of the platforms impacts the way that they act on the platforms. So it's these strategies are developed in tandem with their digital environments. So it's particularly important that these platforms don't incentivize or norm unhealthy or harmful ways of connecting.
That's great. And I would like to throw it back to any one of you guys specifically on this. I think as a researcher, or even as someone who is trying to develop a solution in this space, it seems like it's a moving target that could easily be moved in the wrong direction. Curious if there are any general principles that, as you're thinking about this from a teen use perspective, could be helpful in getting them to both come to the realization of, it's more than just my interactions and digital hygiene, it's my footprint, exactly, all the above, whether anything has risen to the top for you guys in your research to provide guidance in that space. Joan?
I was going to say for us to answer or for
I'm opening it up to your.
Yeah, no. So I think it kind of goes back a bit to what Emily was saying about the fact that teenagers have almost an incomprehensible amount of diverse experiences online, and so we know from, like I said, our report, The Unseen Teen, that tech companies often design their platforms around an imagined average user that tends to be younger, but also male and white. And obviously this ends up marginalizing users whose identities don't fit into this mold. But at the same time, we kind of want to caution tech companies from creating an imagined marginalized user, which is to say that even in communities that are excluded from the norm, that there is a diversity of experience within those communities as well. And so, yes, there's no sort of one size fits all solution. And I guess that's not, a clear answer of how to move forward, but it is a caution that there is no easy solution, that experiences online, like we've been saying, are sort of influenced by a number of factors that, yes, have to do with how platforms are built and how people experience, how people craft their experiences online, but offline experiences are just as important and need to be valued just as much.
Great, thank you, Joan. Emily or Areta, do you have any additions to that? Yeah, okay, well, I would love to bring in Ayman to this, because as someone who is literally building a platform that is trying to address some of these things, I'd love to hear your perspective on what you as your company and other technology companies should be doing to promote more pro-social connection. How do you get at that well-being if it's so varied? And I'd love to hear a little bit more about your process and your thinking there.
No, I appreciate it. Thank you very much for having me today, and I really appreciate all the comments that I've heard up to now. I mean, it's just in terms of everything from being careful not to flatten any problem down to one simple answer, or trying to come up with a silver bullet. There isn't a silver bullet to these things. We sort of have to take a step back and have humility with what is it that we're doing, and realize just how technology changes. It can be an accelerant to certain things in certain ways, and I certainly don't want to age anyone here. I'm happy to do it myself, but I was born in '78. I was raised and born and raised in Saudi Arabia, so quite disconnected from the rest of the world. I mean, we used to receive things. Our access to TV shows used to come in the mail. Basically, you used to get VHS tapes that used to show up, and we used to watch them. But the idea and thinking about how teens grow up with technology today, the old joke, what connects a pencil and a cassette tape? Kids today don't know why you would need a pencil with a cassette tape. And with everyone laughing here, yeah, exactly. You know what I'm talking about. But we're sort of that generation that grew up looking at technology entering the world and changing the world. Whereas, I look at my teenage son and my daughter and teenage daughter and young son, and how technology is just an extension of them, an extension of how they live. And they can't imagine the world without it. They don't know a world that could possibly not have an iPhone that can connect them with their friends with FaceTime in milliseconds, etc. So there is, I feel, a responsibility to people who have seen technology enter into our world, though. Remember what it was like. Remember the fundamentals of social connection, that technology did not need to be a part of our lives in order for us to connect meaningfully with one another. And so the thing that the rule that I prescribe to, that my team and I prescribe to while we're building the product, is remembering that we need to get out of the way as much as possible. We can't be an entity that is part of the conversation. We're an enabler of the conversation. We are an enabler of, what I always say is technology does best when it bridges space and time. Here we are, I'm in Dubai, all of you are in the rest of the world, and here we are talking as if we're in the same room, which growing up was Jetsons technology for us. And as much as we can allow for this kind of interaction where a platform doesn't have its own agenda, that's based on a business model that wants engagement, that thrives off of it, because it's not sustainable, not in 1-2 years, not in a quarter, 2 quarters, 3 quarters. Think 10 years, 20 years from now. And so, for us, we're big believers that people know how to talk to each other, how to grow up with each other, and how to make friends, and how to fall in love, and how to, get their hearts broken, et cetera, like this. We're not inventors of this. Let's, for the whole world, for just people, whether it's young people and adults alike, let's let human nature sort of take its course, and let us be, with a lot of humility and care, provide that as our services as a tool for them to be able to, reach the people that they love when they want, and the people in their lives when they can.
Thanks, Simon. I think that's super powerful to remind ourselves that there are other ways to be doing this, and that we're actually very good inherently of connecting with each other. I am kind of curious, this notion that you brought in about the time in which you can recall that experience of getting the VHS and your relationship with technology. Emily, if you don't mind, I'm going to put you on the spot here. But in the course of the work that you've done, has there been I'm kind of curious of the arc of the change here, right? There are so many more Veros, Clubhouses, Discords, like there are just, is the knowledge different, or is it being more sophisticated? What would you say youths, how do the youth language and understanding if that's changed at all in the last couple of years in the work that you've been doing.
Thanks for that question, Christine. And I really appreciate all the perspectives that have been raised so far. I think this is maybe an adjacent answer, but one of the things we puzzle over constantly is there any dry land? So often it feels like we do research, and then by the time we're even ready to share findings, the apps have changed or their features have changed. And so maybe I'll just share something that we've found really helpful, which is to really take a developmental lens as we're trying to understand what's going on, and to think about what developmental vulnerabilities are relevant, what developmental sensitivities are at the fore, and what sort of developmental needs kids and teens are trying to fill as they're using these technologies. And that lens is really powerful because it can help us understand why something is so compelling, why something is so painful. We know that for adolescents and for girls especially, their friendships are so closely tied to their sense of self and their sense of well-being. And when we think about then features like a snap map, which might show you that your friends' avatars are all clustered together in one place, and suddenly you see that and you realize that your friends have left you out, have excluded you. The experience of social exclusion is not new. The bad feelings that come along with being left out as an adolescent were not created by technology, but there are all these complicated new kinds of social information that are really important for us to kind of tune into if we want to understand teens' experiences. And that's just one example, but there are so many when we think about like identity development and civic participation. I think in each case, just really taking that developmental lens as sort of the dry land can help us figure out what's going on, and then can help us sort of understand why a feature is either so compelling or in some cases is kind of preying on a developmental impulse or vulnerability.
That's great. I love the dry land because it certainly does feel like that. It's shifting and never having the ability to come up with the right research or finding in time. And I think that pushes us quite nicely into what I'm sure everyone has their mind on at the moment, which I'm going to throw to Vaishnavi here. I think we all know, we've seen the recent articles that show that, negative health impacts that Instagram knew ahead of time, especially about teens and girls, and the implication that the company knew that the product was doing that, and how it was addressed. I'd really love to just give some space here for you to help us understand kind of the situation, the thinking, and the pursuit for IG for kids, given the prior knowledge that you guys had. So want to give that opportunity.
Of course. And first of all, thank you for having me. And it's been really interesting listening to the perspectives of the different people on this panel. I think you've got a real diversity of opinions and thoughts here, which is exactly what we've been trying to do on the Instagram and Facebook side. We're really happy to be doing this type of research. It's really important to us that we look into issues that we're hearing about. We started doing this research a number of years ago because we were hearing from our community anecdotally that these were issues that needed to be studied more. So we started doing the research, but as we were doing the research, a couple of things. One, when we do this research, it's meant to provide our internal teams the directional steer on what types of areas to be investing in and doing more on. A lot of that research has directly led to product interventions and policy changes that we've made over the last few years. But the research is also meant to be, it's meant to be directional. So when we finally published some of the decks, we actually included a number of annotations in there that contextualize the research a little bit more. It was written for a closed door audience that's really familiar with these issues and that kind of could benefit from hearing about the issues in a shorthand. It wasn't meant to be something that was, something that would be published externally and that would be that kind of went through peer review and all those processes that we're all very familiar with. That said, I think the research did have some really important findings. One of the findings, of course, was that on 11 out of the 12 yardsticks that we measured people's satisfaction with Instagram on 11 of those 12 yardsticks, people said that they felt better about their time online because of Instagram. And these were people who were already coming to the platform with some sort of pre-existing inclination to feel bad about themselves. So that is actually a pretty powerful statistic. Now, the one yardstick in which people didn't feel like they felt better about themselves after the time on Instagram was body image. That was for teen girls. And that's exactly the type of finding that has led to a number of product interventions over the last few years. Just at the beginning of this year, we announced a holistic package of remediations to target people who may be struggling with thoughts of eating disorders online. We launched one of the things that we had heard from the research, and not just internal research, but the external research that we do with researchers, as well as the expert feedback that we look to get. One of the things that we heard was that it's really important to offer resources to people when they're in a headspace to receive it. So, you can provide resources or offer people help at various points in their journey online, but you really need to find the right moment where they are most likely to utilize the resource. And so one of the ways in which we did this was to really look at the moment when someone is searching for a term related to eating disorders or related to suicide and self-injury. So as an example, if you were to search, say on Instagram for the term anorexia, before we show you the results, we'll say, hey, do you need help? Or do you need someone to talk to? We've partnered with a number of eating disorder hotlines globally so that we can offer localized resources, so give them access to a local hotline whom they can reach out to. And we've also developed a series of tips on how to address this issue in that moment of crisis. We did that in partnership with the National Eating Disorders Association. So that's a very kind of tangible example of why we do this research. My biggest hope from, I think, everything that has come out over the last few weeks is that people recognize the importance of doing this research, the importance of companies investing in and being willing to have these difficult conversations. These are not easy conversations to have, and I'm personally very glad that we do this research. It would be a shame if, this was seen by the industry as a reason to not look at the problem at all, or to not actually, actually try and understand what the issue is. And I think in terms of where we go going forward, one of the things that has really come up from the research is that not just the internal research, but we work with our youth advisors, for example. We have a group of advisors we consult with for suicide and self-injury, eating disorders and well-being. One of the things that has come up is that people feeling bad about their time online generally tends to be a combination of three factors. It tends to be a combination of what they're seeing, how often they're seeing it, and I forget who made this point. It may have been Emily or Joan, I apologize, but really like the state of mind that the person was in when they were engaging online. That also plays a significant role. So we're in the process of testing out a few new product features. These were features that we had been working on even prior to the news of these last few weeks. And we're looking at ways to sort of nudge people in their time online. So encouraging them to take a break when they've been just kind of in a doom scroll of content for a long period of time. Or if we see that they've just been spending a lot of time on a particular type of topic, perhaps nudging them to consider another topic as part of their experience. These are tests. I don't know how successful they'll be. I think the people on this call are probably really familiar with our very public testing of hiding likes over the last 2 years and some of the outcomes from that. It is a little scary to do these tests in public, to be honest, but I do think it's the right thing for us to do, and to be able to say, like we did with hiding likes, that actually the results were quite mixed and it didn't actually lead to the types of changes we thought it would lead to. So I hope that that's helpful. Of course, happy to kind of answer more questions as they come up.
Yeah, thank you. I appreciate that. I'd like to invite anybody on the panel to also jump in if they have questions. But I think one of the things that is interesting here is that in some ways we're coming into a generation of users and digital experts who can probably navigate whether that nudge is appropriate for them versus whether the organization or the platform should do it on their behalf. I am curious, either from Ayman as as the platform creator, or from any of the researchers, whether there is a place here for youth to change that, or to be the leader in being able to say whether or not that's what they want, and how do you make that happen, right? So I think that's a really interesting problem for anyone working in that space. I see Ayman, your mic off if you want to jump in.
Yeah, I mean, I want to give the opportunity for others to jump in on the conversation. I mean, I know, it's sort of this situation where if as a platform you're displaying content for somebody in a way that isn't just informative, it isn't just like something that we hold on to quite dearly is a chronological feed, for example, from everybody that you're connected with or that you follow. And so there's nothing in your feed that is coming from anybody that you haven't yourself opted into following and subscribing to, or getting their information, their content, the things that they have to say, the things that they share. So in a situation where you're presented with content that's coming from a platform's sort of decision on whether this content is under a particular heading, a particular subject, etc., then you need to, as a platform, again, sort of balance that out with the kinds of actions that were just described. And that's where it's sort of a slippery slope for us. I mean, we always think, give people the tools and they will figure things out for themselves to be able to, to navigate whatever content they're looking for, whatever they're looking, whatever information they're trying to receive. I mean, certainly if they're looking up things that there's very little reason why they'd be looking them up in terms of terms, as was described before, that certainly giving information, extra information that can educate the user and the person, I think that's a good idea. But when it comes to sort of the platform's intervention, well, what was done previously that led to the intervention needing to be made? And so it's sort of looking at the source of that. And for me, I mean, I do, we just try to avoid it completely. So
yeah, I understand. Thank you. I appreciate that. We have only 5 minutes left, and I feel like that's doesn't do this conversation justice, because there's so much more that I'd love to sit here and unpack. I think I'd like to bring back a little bit for the audience, kind of both the expectations that we should have of technology companies and how we should be approaching our relationship with them. As one open question I will allow the group to noodle on, but also to that end, like what could we as either academics, practitioners, parents, teachers, public health officials do to better prepare our youth as they navigate kind of the increasingly connected future? I would love anyone to kind of get at either one of those questions as we wrap up in 4 minutes. So does anyone want to take a quick stab? Yep.
I mean, I have some initial thoughts, and in my role as our head of safety and well-being, I think about this a lot. I think a lot about how to make sure that young people are having safe and healthy experiences online. But I think we also have to be really cognizant that the young people are growing up online, and that the internet and social media is a huge lifeline for them in terms of building connections, forming their identity, learning more about this world that they're in, norms and expectations of the communities that they're in. And so one thing that I kind of think about a lot is, how do we really balance the agency of young people and their rights and the opportunities for them to really discover who they are, with the need to keep them safe. Over the last few years, for example, I've been so amazed by the types of young activists who have come up to talk about issues as diverse as, you know, Indigenous land rights, political protests, social issues. How do we make sure that we can build an internet that lets them do all those things in really productive, important ways, while still keeping them safe from, you know, the worst of the worst, as there is with any kind of online platform? That's something that I think about a lot, and I try to kind of get a lot of input from our partners and safety and well-being stakeholders on.
Thank you. I know that you guys do that pretty pretty actively, and I know some of the people on this panel are part of those conversations. I would love to hear from Emily or Joan or Reti, kind of similarly, you know, what are some of the things that we can be doing here, and what are the expectations that we should have as users and or, you know, stewards for the youth in their relationship with technology. Joan?
Yeah, I was going to say, you know, I think we touched on it a bit before when Rachel and I were talking about, you know, cautioning against creating an average marginalized user. But I kind of want to sort of inject into this conversation that young people, you know, regardless of what platforms are doing, how they're changing their strategies and you know, online experiences, they are taking their virtual worlds into their own hands. And that's what strategic knowledge sort of offers, is that proof that young people are actively shaping platforms to fit their needs independently, and in some cases, like in spite of what tech companies are doing. You know, I think of like, if your mom tells you to clean your room and you're already going to clean your room, but now that she told you to do it, you don't want to do it anymore. I think that that's an important element to consider here. And so I think in terms of like our expectations, I think that knowing that teenagers, that young people are, you know, always going to be finding new ways to sort of subvert and manipulate platforms to make them fit their needs, that platforms should focus instead on, you know, examining their own flaws and biases before, you know, imposing them onto us and passing the responsibility to create meaningful connections onto the most vulnerable members of our society, right? So knowing and keeping young people and their, I guess, you know, activism as central to their experience, I think is important here, but also not sort of in turn putting that responsibility back on them to make their to sort of also like tell us what their problems are, but also to make their virtual experiences better.
That's great, Joan. I could not ask for a better way to bring this home, and you're getting some enthusiastic reactions in chat. So I think that's a wonderful space for us to leave. I think, you know, again, there's so much in this intersection that we could spend lots and lots of time of. And I really, you know, encourage anyone out there who's listening, if you're interested, to please reach out to all of us. I think you could probably find our profiles online and to engage, because this is certainly one of those spaces that requires a lot of different perspectives for us to get a better handle on how it all works. So with that, I thank you, all of you, for your time. It's too quick, and I'll send it back over to our friends over at the Coalition.
Thank you so much, Christine. Thank you all, incredible panelists, for being here. We really enjoyed, you know, listening to that insightful dialogue and updates on research. I love what Eamon said about, you know, never forgetting that the fundamentals of social connection, even though we know technology will forever be a part of our lives. So for our final segment, I want to move it over to look ahead, right, and look about the new commitments to action. This segment will be brought to you by Cindy Jordan, CEO of PICS Health, to share about their immensely important work in addition to some personal reflections. And then Cindy will be introducing this year's new collection of commitments to action, which are pledges made to address social isolation and loneliness and are really the crux of why we are all here today. So Cindy, thank you so much for being here today, and I will turn it over to you.
Thanks for having me. I'll be relatively brief, but before I get going, I sort of wanted to congratulate CESIL on a few, as we're sort of retrospectively looking back at the new year, and we're going to roll in the new commitments for the year to come. There's been some major accomplishments on behalf of CESIL, and these are in no particular order, but the first being the Elder Justice Reauthorization and Modernization Act of 2021, which included $250 million in funding to address social isolation and loneliness. And CESIL played an instrumental role in getting that through. Also, their work with the Gravity Project, where they were heavily influenced in getting an ICD-10 and other billing codes developed for the first time. And for me personally at PICS, and we're going to talk about this, I believe that billing codes are a way for loneliness and social isolation to actually be taken seriously by the healthcare industry. And finally, they were a founding member, and they are the current co-chair of the Global Initiative on Loneliness and Connection, and that's an international organization committed to ending the pressing global issues of loneliness and social isolation. So congratulations, CESIL. You all are the shining example of keeping your commitments and having a lot of progress to help our common goal of ending loneliness and social isolation. So I'm Cindy Jordan. I am the co-founder and CEO of PICS Health. We've been a member of CESIL since 2020. And for those of you on the phone that might not know us, what we do is we solve for loneliness and social isolation, particularly focused on vulnerable populations. So think about Medicaid and Medicare Advantage. So I don't know if a lot of you know how the company got started, but I brought a very short video to show you how we started.
Hi, I'm Cindy. And I'm Ann. And we're the co-founders of PICS Health. And we're here today to tell you why we started the company. This is actually our second healthcare IT startup company. And after we sold the first one, I didn't think we would do another one.
No, I thought we would be kind of out on a boat having fun.
Yeah, exactly.
But then in 2017, our daughter Riley had a terrible year. She was diagnosed with bipolar, was in and out of the hospital, and ultimately ended up in a facility.
And when we sat down with her after we got through it as a family and asked her what we were missing, like what comes first, she said before things go bad, she starts to feel profoundly lonely. So we started researching loneliness. Very little is being done in the US within the healthcare industry. Even though loneliness is one of the top 3 symptoms in deadly conditions like alcoholism, bipolar, depression, and many others, we believe you need to identify and treat loneliness as a chronic condition. If you Google how to solve loneliness, it will tell you it can be solved with a 10-minute phone call or by getting active. That is not the case. Chronic loneliness needs to have a scientific, thoughtful-based approach.
Loneliness is not about how many people are around you. It is the feeling that you are alone and no one else can understand the burden that you are carrying. And that is how Riley felt.
This summer, Riley lost her struggle with mental health issues, and it has altered our family forever. One of the last texts she ever sent to anybody in this world, she said how lonely she felt. It makes the mission of PICS even more profound to the two of us.
If we can help one family, one person to not struggle, then Riley's legacy will live on.
So, actually that's relatively new. This is probably the first audience that we've shown that to. So sorry for stumbling through this a little bit, but as you can see here at PICS, this is not just our company, and we're not out there. This is very personal to us. We're very mission driven. We believe that loneliness was a major contributor in the loss of our daughter. And so we want to do all the things as we can as a company, but also as individuals. So let me just show you super quickly how it works. Lonely people utilize healthcare differently. That is a fact. When people are lonely, they are often seeking services in the wrong places, overutilizing, etc. Finding them and helping them is the hard part. And I think that all of us on the phone can talk, understand how difficult that is. So what we do at PICS is we generally partner with payers, and we take their data and we have what's called a loneliness index. And it's a proprietary algorithm that can search through their members and find the chronically and intermittently lonely. So that's half the battle. Once you find them, then what do you do? So our solution, and I loved the panel that I popped in on at the end right before this, is really to use a technology and a human intervention. I call it the peanut butter and chocolate. You need technology because you need a scalable solution that goes beyond, what humans can do. And for us, our technology, which looks nothing or acts nothing like a social media platform, has a very empathetic, super funny chatbot that never treats the end user like a disease state or a diagnosis. He acts like a friend in a coffee shop. And what happens is people start to trust him as they're using it. And for those of you that are thinking, oh, who would use this? Our average, we have people on the platform from age 18 to 104, and our average user is 54 years old and male. So anyway, as Pixar starts to develop a profile around the user, or we find out that someone has an urgent social determinants of health need, we have a whole group of people in our compassionate care center who we call our Andes, and that stands for authentic, nurturing, dependable, your friend, and Andy intervenes. You can go to the next slide. So there is a difference when Andy gets involved between intermittently lonely and chronically lonely and isolated people. And so when we find that someone, and we use evidence-based screenings like the UCLA3, we also screen for depression and anxiety, but when we find someone's in trouble, we'll actually enroll them in our PICS Thrive pathway. And the reason I decided to bring this up is because we didn't have this last year when we joined the coalition, and it's relatively revolutionary. It's based in positive psychology. It's what I'm going to call loosely a real treatment for loneliness. So what happens is when we find the chronically lonely individual, we'll enroll them in this 8-week program, and they will have regular interventions with the Andy. And then there's lots of things inside the platform that we ask them to do. So it's relatively new. We just launched it 3 months ago, but here's the big news: 86% better than average improvements on loneliness for users that completed Thrive. So we are super encouraged and are studying this to think, gosh, this really might be an answer for when people are in that chronic state where their body is in that fight or flight and they can't engage in other services. You can go on to the next slide. This is just a visual of some of the cool stuff that goes on inside the platform with Thrive. I'll just call out one thing because it's kind of my favorite, but we're launching, and this all starts on November 15th, what's called PICS Pets. It's been scientifically proven that taking care of a virtual pet can actually improve loneliness rather significantly. And so there's that and all different kinds of things that goes on inside of there. But you can see here, we have a very simple, super friendly, very vibrant user interface. And I think this keeps people, engaged. You can go on to the next. So where is PICS and how are we doing? And please don't take this as self-congratulatory. I'm just trying to show here that this is a message that is resonating with payers and with people, and that over the last year, we've entered into 20 markets. Our average day on platform is over 100 days. And for those of you on the phone, that is actually better than Weight Watchers. We have seen a 74% improvement in loneliness, again, using evidence-based screenings to determine these improvements. And for our payer partners, a 57% reduction in inpatient and ED utilization. What's the message that I'm trying to convey? It is that it works. When we actually identify and treat and loneliness, we can improve people's health, and in the case of Riley, potentially even save lives. So that's all I've got on picks. I want to introduce all of you to this year's new commitments to action.
Never Tech Late was founded in 2019 by New York-based executive Florence Mauchon. It is supported by a 6-person advisory board and a small, dedicated team. Never Tech Late delivers remote digital instruction to older adults by teaching how to use a tablet, how to communicate with friends and family online via tools such as Zoom, and how to stay safe online. We promote social engagement and lifelong learning through a heavily researched program and curriculum that was developed in conjunction with the instructional design experts at the Indiana University of Pennsylvania. This curriculum consists of 8 one-hour lessons that are delivered over an 8-week period. They are delivered by Never Tech Late coaches who have undergone 15 hours of training in order to be fully prepared to deliver this instruction. The Never Tech Late team also developed a train-the-trainer platform and program through which future coaches can learn the art and methods of teaching older adults technology. Why do we do this? Because one, as research has repeatedly shown, a decrease in loneliness and social isolation can lead to a decrease in instances of cardiac and neurological illnesses. 2, lifelong learning and engagement promote independence and a healthy aging in place. And 3, the ever-growing digital gap risks creating even more inequalities across the age spectrum, especially during this current COVID-19 era. The best way to reduce this digital divide is to empower older adults to master such tools as Zoom and the tablet, and many others. Our programs are rooted in listening to our users, qualitatively by conducting focus interviews, for example, and quantitatively by conducting pre- and post surveys. Never Tech Late is very honored to join CESIL in 2021. We are delighted to be a part of this very important network of organizations that fights every day to end social isolation and loneliness. With this in mind, we are pleased to submit an ambitious commitment to action to this year's annual action form. Number 1, Never Tech Late pledges to teach at least 100 new adults how to use a tablet and master Zoom. We will do this through at least 2 of the 5 channels that we have targeted, including older adult residential organizations, low-income communities, community colleges, veterans associations, and area agencies on aging. We pledge to also certify 12 coaches through the Never Tech Late Train-the-Trainer program. Third, we commit to launching at least 1 additional module, such as using a tablet to support health and wellness, email and technology troubleshooting tips, and building a music library. We aim to finish out the year 2022 by creating a video with our graduated students where smiles and technology expertise abound. Never Tech Late intends to meet these goals by continuing outreach efforts to, for example, older adult residential organizations that have a demonstrated need for older adult technology education. We also intend to continue conducting high-level conversations with various key stakeholders. And we intend to continue identifying potential corporate and government agency partners. Again, Never Tech Late is very honored to join CESIL and, of course, the Foundation for Social Connection Networks. These represent a critical source of support as we aim to meet the above goals. Thank you for your attention. We look forward to meeting you either in person or virtually.
Hi, everyone. It's Laura Telmes. I am the executive director and co-founder of a great organization called Beyond Differences. We are based in the San Francisco Bay Area. We're a national organization, and we are almost 12 years old. We partner with schools all over the United States. 8,500 schools at this point use our social and emotional learning curriculum, our student leadership activities, and we now provide professional development for teachers. I'm honored to be invited back again to give you our goal for this year, our call to action for the 2nd annual Action Forum hosted by and organized by the Coalition to End Social Isolation and Loneliness. I'm a huge fan of the organization, and we look to partner with them all the time. So my personal goal is to make sure that every child goes to school every day feeling accepted, valued, respected, and included by their peers, no matter what their difference is. Social isolation is something that we should all be very worried about, especially as we come out and ease out of the pandemic. The incidence of social isolation and children's self-esteem from being disconnected is at an all-time high, and we've got to remedy that, and the children themselves are the answer. So let's give them the tools, the training, the inspiration, and the power, and they will take care of making sure that their classmates feel accepted, respected, included, and valued every day in school. Thank you so much. Have fun at the forum.
Hi, everyone. My name is Chris Micton. I work for the World Health Organization. I'm a technical officer in the Demographic Change and Healthy Aging Unit. And we at WHO are making a commitment to action in the following areas. What we intend to do is implement the strategy we've published in a recent advocacy brief. And this strategy is made up of 3 components. The first one is to contribute to the creation of a global coalition to increase the political priority of social isolation and loneliness. The second component of this strategy is to improve research and strengthen the evidence for effective interventions to address social isolation and loneliness. And the third component of this strategy is to start implementing and scaling up effective interventions around the world, including in low and middle income countries, to reduce social isolation and loneliness. And we intend to do this over the next decade or so within WHO's and other UN agencies' decade of healthy aging.
The Motion Picture and Television Fund pledges to continue our support of our partners across the country to amplify efforts to reduce social isolation and loneliness. MPTF will continue to offer our Social Call training program free of charge to any organization that would like to launch or expand a social call program of their own. To date, we've trained 150 organizations in 30 states. By the end of 2023, we'd like to make that all 50 states, ultimately engaging thousands of high-risk older adults. The Southern California and Los Angeles Social Isolation Impact Coalition will continue to grow, and will expand our efforts to share best practices, up-to-date research, and we will continue encouraging the data collection of all programs. We will also stay involved with the National Coalition to End Social Isolation and Loneliness to advocate for policy changes to improve social connectivity for anyone.
Hi, I'm Lindsay Morrison, Eventbrite's Vice President of Policy and Platform Operations. At Eventbrite, our mission is to bring the world together through live experience. We firmly believe in the power of gathering and that social connection is critical to a thriving society. And we are uniquely positioned to bring awareness to the pervasiveness of social isolation and the ailments it causes. Over the next 3 years, we are committed to amplifying the power of connection and combating social isolation. Specifically, Eventbrite's commitments include raising awareness about the issue of social isolation and the power of connection, reducing the stigma associated with social isolation, and elevating the physical and mental health effects of social isolation as a public health issue. Today, Eventbrite commits to partnering with CESIL, the Foundation for Social Connection, and other experts in the field. At Eventbrite, we bring the world together, and we believe in the power of social connection as a remedy to the ailments caused by social isolation. We're excited to get to work and join each of you on this journey.
Hello, I'm Annette Fellows, Vice President of Health Products and Services at United Healthcare, and I lead the Healthcare Transformation Team. At United Healthcare, we have the honor of serving 1 in 5 Medicare beneficiaries and understand that 80% of what impacts a person's health happens outside of the doctor's office, like with housing and food and social isolation, to name a few. Through a deep understanding of those we serve and with the goal of helping people lead healthier lives, we continue to elevate the topics of social isolation as well as loneliness by focusing on a new lever of improved health called, or what we call, personal determinants of health. Factors that build individuals' resilience to withstand life's challenges. Factors like purpose and possibilities, which includes optimism. Like people, which includes social connection and a focus on loneliness. Through research and partnership with organizations on the front line, we have learned much about the importance of caring for the whole person, and driving awareness around all the dimensions of health ultimately leads to better health outcomes and experiences with care. So we commit to continue to apply and expand on these learnings through research, segmentation and targeting, interventions, and programs for our members in 2022. Thank you to all of you for keeping these important topics of social isolation and loneliness on the forefront.
Hi, everyone. What fantastic momentum we can look forward to in the year ahead. A personal thank you to Cindy Jordan from PICS Health for her leadership, friendship, and vulnerability in that last segment, and to all of the organizations that make commitments for the year ahead. And in rounding out the commitments to action, the Coalition and the Foundation will also seek to double down on our own commitments and continue to contribute to the evidence base in the year ahead. Together with our Scientific Advisory Council and input from all of you, we are committed to developing and advocating broad uptake of the social connection systemic framework. As you heard yesterday, this framework dials in on the intersections between the socio-ecological models, levels of impact, diverse sectors, and across the lifespan to identify existing best practices and gaps in research and evaluated approaches. Additionally, as you heard from Risa Wilkerson from Healthy Places by Design, we will begin a partnership with them to support a broader social connections learning and action network in the year ahead. This marriage of efforts will bridge our team's work in communications, policy, innovation, and research with Healthy Places by Design's work to support community-level systems change and philanthropic leadership in this space. The ability to have cross-cutting learnings translated across various focal areas is of vital importance in closing gaps in social connection and well-being. We look forward to updating you all on our progress as we work towards a holistic and systemic approach to address social connectedness. Now I'll turn it over to my partner, Andrew McPherson, to join me in some closing remarks on this second action forum. Andrew.
Well, Eddie, I'm just overwhelmed. It goes without saying that this has been an absolutely tremendous 2 days. I first want to thank all of our speakers, from the US Surgeon General to leading academic voices to grassroots and community-based organizations, global colleagues and leaders, from young Americans and older adults to members of the House of Representatives and the US Senate and even the Biden administration. Boy, we heard from just an extraordinary array of change makers from across the country and across the world. I also want to thank our extraordinary team at the Foundation and at the Coalition: Jillian Rakusin, Meg Wallace, Connor Beauregard, Rachel Jordan, Matt Itzkowitz, and of course my incredible co-director, Eddie. Isn't he the best? Thank you all so very much for your tireless work in developing and leading this event. We're also very, very grateful for the support of the team at Meals on Wheels America, who are instrumental in producing our action forum over the past 2 days. Thank you. And to our steering committee members, who are instrumental in leading and supporting our work throughout the year. But finally, we want to thank you, our attendees and change makers from across the country and across the world. I hope you're leaving our 2021 Action Forum feeling inspired, feeling informed, feeling engaged, and yes, ready for continued action to address the national crisis of social isolation and loneliness. Look, the statistics, as we know, speak for themselves. It is indeed a crisis of mammoth proportion. But these past 2 days have reminded us over and over how much reason we have to be optimistic about how far we've come in addressing the crisis, not just in this country, but globally, and how much opportunity we have moving into the future. We will only realize this potential if we continue to connect, to collaborate, and to lead a movement, leveraging all of our voices to ensure we leave no one behind in this country and well beyond. So thank you very much for participating with us these past 2 days. We invite you to join us next year for our 2022 Action Forum, which will take place October 11th and 12th. We wish you all the best. We wish you well and look forward to our continued work together. Thank you so much.